Morning, everyone. Welcome. We gathered a year ago. It seems like much longer for the 42nd breakfast. So I'm very glad that we could gather again today. We never would have imagined what the last 12 months have brought us, and that we'd be all at home this morning instead of having breakfast together. So I appreciate everyone being here and all the folks that have figured out how to use Zoom to be here with us. Thank you so much. Let's see. So for individuals and families who are joining us, we're so glad that you can, because these have been extreme circumstances. And we're so glad you could be here to talk about the perfect storm and the pandemic and racial inequality and social justice. I believe we have over 675 people registered today. And I'm so glad that none of us had to think about our travel or babysitters or getting dressed up or comfortable shoes. It's one of those fantastic silver linings of a virtual event. And because of that, we have more folks joining us from the mountains and the coast and even from other states to hear updates on our mental health services in North Carolina and hear the lived experiences of Donna Carrington and honoring Representative Carla Cunningham and engage with our panel of North Carolina legislators. But I would like to see where everyone is from. So I think we're going to have a little poll, and if folks could select where they are from and how far they might have traveled today. So just pick the city that's as closest to where you're at, and we'll see where everybody's come from. But this is one of the fantastic things about being virtual. So Tony, I can't see that. So if it pops back up.
So currently we are at 83% have voted.
Okay.
Yep. So if you want to leave it up for a little bit longer, we can. If you want to just go ahead and close it out, we can do that as well.
Let's go ahead and see what we've got.
Sure. And let's share these results, and you should be able to see that.
Fantastic. Wow, we definitely have some folks from out of state joining us today. Thank you so much. I'm sure everyone appreciated not having to drive here. So another question that I often ask all of you is who is in the audience today? We are an event that attracts a lot of different folks, from people with lived experience to elected officials and legislators. So let us know who you are. Just take a couple minutes for that. So part of our day today, we enjoyed performances from Josh Lozoff, and so I hope that you stay on the call to the very end, in which case you will be automatically entered into a drawing to win a virtual show for you and your family or your colleagues or your cohort. So make sure you stay on to the end. All right, so do we have the results of that poll?
There you go.
All right. Oh, fantastic. So pleased to see so many folks here with lived experience representing either themselves or their families. It's so important to hear your voice. So I'm really glad that you're here. So thank you so much. So in other news, this is going to be my final year as lead chair for the legislative breakfast. And I'm passing the responsibility to the very capable and breakfast experience, Max Shafir. He is LCSW and has volunteered for the last 5 breakfasts on the steering committee and his career experience has been working with clients who face challenges and obstacles in their daily lives. So please welcome Max Shafir, lead chair for 2022.
Thank you very much, Jenny. I really appreciate that. I just want to say thank you for your leadership and your guidance in these past years, especially this year, as we've navigated uncharted factors and considerations in the planning of this 43rd legislative breakfast. I want to say that I look forward to the next steps that I'm going to have to take in my lead role. And I know that our committee will continue being great because you're going nowhere. So I am still excited to have you close by.
Thank you.
I want to take this opportunity to also welcome Senator Mike Woodard. He is graciously serving again as our Master of Ceremonies. Senator Woodard represents District 22, including Durham, Granville, and Person counties. Prior to his election to the Senate in 2013, he served as Durham City Council for 7 years. In addition to his legislative duties, Senator Woodard is active in community organizations and has been honored with numerous civic awards. So thank you very much, Senator Mike Woodard, and I pass it on to you.
Great. Thank you, Max, and good morning. It's my pleasure to be with you again and to serve as your Master of Ceremonies again this year, proving that good help is hard to find and that you get what you pay for. So welcome to our 43rd Legislative Breakfast on Mental Health. Of course, the pandemic has changed so much in our lives and how we do things that it required that we adjust our breakfast today. I know we'd all rather be at the Friday Center enjoying incredible breakfast and each other's company. But the change with the pandemic really does not diminish the resolve we have to address all the challenges we face as individuals, families, communities, policymakers, as a state, a nation, and a world, as we face so many challenges and the disarray that we've seen. The theme of today's event, the perfect storm, pandemic, racial inequality, social injustice, is both a description of our current reality and also, I think, a rallying call for action and response. And I hope by the end of our morning together today that the presentations and conversations we'll have will be further encouraged and energized to seek better outcomes and reduce the detrimental impact of mental health and wellness of the pandemic and continued racial inequality and the divisive social injustices that we've seen. Let me take a minute to acknowledge some of the individuals and organizations who made today's programming possible. You've already met the incredible Jenny Ladd and Max Shafir, and additional event co-chairs this year included Linda Foxworth, Andrea Whitehouse, Chase, and Karen Dunn. And the incredible staff at the Friday Conference Center have been working behind the scenes, pulling all the technical wizardry together. And I especially want to thank Tony, who's with us today with headset and all the equipment to make everything happen. And that's allowing us to participate from our homes. And in my case, and Senator Bergen, I see, we're actually in our offices today. The North Carolina chapter of the National Association of Social Workers coordinated the registration and sent out the Zoom links to the 675 folks who are online with us this morning. And the generous financial and in-kind support of our breakfast sponsors made it possible for us to invite students and community advocates, as well as individuals and families directly impacted by mental health issues and the challenges of accessing services. And through the participation of our lived experience speaker today, Donna Carrington, members of the North Carolina General Assembly, Governor Cooper, Dr. Cohen, Cody Kinsley, and Dr. McCoy, and a whole bunch of other elected officials, we have a front row seat to listen and learn as together we navigate through the uncharted waters during this perfect storm. Now, to kick off our program today, I'd like to now present to you a video message from Governor Roy Cooper.
Tony, you're not getting audio.
Okay, looks like we're going to have Governor Cooper come on soon.
Hi, everybody. Governor Roy Cooper here. While we can't all be in the same room this year for the legislative breakfast on mental health, I'm grateful to be able to speak with you today. More than 2 million North Carolinians battle some form of mental illness, and we know it has been exacerbated during this pandemic. Losing jobs, caretaking for children and parents, isolation from holidays and traditions, all of these take a toll. As governor, I'll continue to push making health care more accessible to all communities so people can seek out the treatment that they need. This includes closing our health care coverage gap, expanding Medicaid, and supporting our students by investing in school nurses and counselors. A person's mental health is just as important as physical health, and often they're tied together. Let's work harder than ever to get people the help that they need. Thanks so much.
So when you run for public office, you often have things you want to work on. We often hear of peacetime or wartime presidents or an infrastructure senator. North Carolina's had a half dozen education governors, but I don't think anybody runs to be the pandemic governor. It takes great leaders who deal with the cards they're dealt. And certainly Governor Cooper has faced great challenges running our state through the pandemic over the last year. And of course, his partner in that has been our Secretary of Health and Human Services, Dr. Mandy Cohen. So it's been a long, hard 12 months of checking, adjusting, readjusting, readjusting, and as all kind of new information emerges and protocols change and the whole world around us is very, very different. So I just wanted to thank both Governor Cooper and Dr. Cohen for their leadership during this unprecedented time. I've had a chance to introduce Dr. Cohen on a number of occasions, and today I get to do that again. But we all know Dr. Cohen's incredible credentials, Cornell, Yale, Harvard, the incredible work she's done serving as COO at CMS for 8 years. And then 4 years ago, the chance for her to come and serve as our Secretary of Health and Human Services. One thing she's added, a new thing she's added, I hope she puts it on her CV now, is she was chosen by the News and Observer as the North Carolinian of the Year. And I can't think of anybody more deserving these challenging times. And we're so glad to have her steady hand, knowledge, and great leadership on the rudder as we've navigated through this perfect storm. So please join me in welcoming our Secretary of Health and Human Services, Dr. Mandy Cohen.
Good morning, Secretary Cohen.
Good morning, everyone. Good to be with you. How is everyone this morning?
Great. Good morning.
Good morning. It's almost as if we're drinking orange juice right now at the Friday Center. I can feel it.
Almost.
They are busy giving vaccines out at the Friday Center today, so that is a good thing.
Let's see. I think you can go ahead and get started.
All right,
You're on,
terrific.
Dr. Cohen. I introduced you, and now you're ready to go.
I'm ready to go. Oh, sorry. I apologize, Senator Woodard.
You
Well-
missed my great introduction. Come on. Let's go.
Thank you so much, and sorry to pop in. So good morning, everyone. Wonderful to be with you. Thank you, Senator Woodard, particularly for your leadership in the General Assembly with many of our other General Assembly partners on really being a champion for those with mental health and IDD needs year over year. You were just such a consistent champion for them, and it is incredible to have that leadership in the General Assembly. Before I dive into the state of of mental health for North Carolina, and it's been a tough year for everyone. Just a note on where we are with COVID and this year. I think our state has done incredible work despite the huge challenges that we have faced over this year, the pandemic just being one of them. I think the pandemic was one, really wrestling with hard issues of racial injustice this year. I think our state has pulled together and strength and resilience over and over and over again. But I know it has been incredibly hard. If you look at the numbers in terms of COVID cases and COVID deaths, and you look at our cohort here in the Southeast, the numbers speak for themselves in terms of the work we have done here in the state. And I see that work happening yet again as we enter this new phase of pandemic response with vaccines. Now, we got off to a little bit of a slow start here, but our vaccine providers roared back and showed that they have pulled together as a state. And earlier this week, we shared that we had used 99% of all first doses of vaccine that came into our state before we got that next shipment from the federal government. And it demonstrated loud and clear that North Carolina is strong, that we are ready to take on this pandemic response, and we are certainly ready to take on more vaccine for the folks here. But the sad reality of where we are with vaccine is the supply is incredibly, incredibly limited. We knew that, but the numbers now speak for themselves. We are getting first doses in incredibly quickly, and that is our expectation of our vaccine providers, is to move quickly and to move equitably as they do it. But the reality is we just have very, very little vaccine. And I know that's incredibly frustrating and adds yet another level of anxiety and frustration to an already anxious and frustrated and tough year for folks. So we are going to have limited supply of vaccine for quite some time. We are still prioritizing those who are 65 and older. I know that those who have a lot of other needs are waiting for vaccine. And I wish we could get vaccine to everyone right away. But we know that it's going to take us a number of months to get to everyone that I know needs a vaccine, that wants a vaccine. So be patient with us, which I know is so hard after this whole year, and that we want to get back to being pre-pandemic, having orange juice breakfasts together in person, but we will get there. So please do have patience with us. And I just, again, thank you to all the vaccine providers. As I was mentioning, the Friday Center is right now delivering vaccines while we are holding this virtual session. So that is great. But let's talk about the state of mental health and how we at the department have continued to keep our eye focused on needing to make sure that there was mental health access, particularly at this time of crisis. You're going to hear from my Deputy Secretary, Cody Kinsley, who is just incredible. I cannot tell you how lucky we are as a state that Cody Kinsley came back to his home state of North Carolina, Wilmington raised, worked in DC, but came back and he has been such an asset, not just in running the mental health IDD work, our facilities work, but has taken on the operational role in our response to COVID. He's just incredibly talented, but in taking on that role, he has never had his eye leave the ball on making sure that we were making sure that we were getting resources to those with mental health, behavioral health, IDD needs. And in fact, more than $100 million of federal dollars from the Coronavirus Relief Fund went into those efforts. And his team, and you're going to hear from Victor Armstrong as well, who all did an incredible job making sure that we can continue to provide services. I know he's going to talk about the multiple hotlines that we had, not just for the general public, 24-hour Hope for NC helpline that was out there, but additional resources to make sure folks could connect with telehealth visits and get the access that they need. But also we thought specifically about our healthcare workers and the kinds of strain they would be under this year, and set up a separate help hotline for them to get the support they need. This has been a really tough year. And so Cody Kinsley, Victor Armstrong, the entire team, Carrie Brown, Dr. Carrie Brown, incredible leaders. We are so lucky in North Carolina. But look, this is a crisis, and these are challenged. The mental health system was challenged well before COVID. You all know it. It's why we get together every year to make sure we're keeping focus on that topic. But we are so lucky in North Carolina. And I saw that yet again when the governor convened a coverage council starting this past November. He convened a council to say, look, we have to get more access to care across the board for folks in North Carolina. We still have 1 million folks in our state who are uninsured. We can do better. There are tools out there. And I hear from everyone that we want to do better. Now, everyone has different approaches to that. I've obviously been very clear that I think Medicaid expansion is the right avenue to expand coverage, because we can get in full federal support for that program, and you get comprehensive coverage. And I'm going to continue to advocate for that. And I know there are many friends and colleagues on here who continue to talk through it. But what I was heartened by with that coverage council, because it was a group of bipartisan leaders, business leaders, small and large, advocates, mental health advocates, physician leaders. What I kept hearing over and over was a shared articulation of us needing to close the coverage gap, number one, but also a real commitment to thinking about mental health and making sure that that was very much a part of what we were doing as we think about access to care going forward. I heard that from every corner of that council that was representing so many. And so I know there are many types of solutions that we need. And as we all know, an insurance card does not mean that you get access to mental health care. We know it. And so one size does not fit all here. One solution does not fit all our problems here. I think Medicaid expansion is incredibly necessary, more than ever, to respond to COVID and the crisis we're in. But it is not the only solution that we need. And we also need to be thinking about the core infrastructure of our mental health system, because we know from other disasters that the long tail on our mental health, that strain that we are seeing is just starting. And that is hard and sad to think about. We've seen it in other downturns of the economy, hurricanes. We know there's an intense period during the crisis where there's certainly strain, but we know this is going to be a long, multi-year effort. And we already know we have a strained and under-resourced system. So we have a lot of work ahead of us. Again, I think Medicaid expansion is going to be that tool that we need to help us, but it's not the only tool. And so we have a lot of work to do. I know Cody is going to outline a lot of what we're thinking about in terms of ongoing investment. One of those pieces is, as we are thinking about our Medicaid transformation. Remember that when that was our top issue that we were talking about before COVID hit, but we have not let up on that. And the General Assembly has definitely said, go forward on Medicaid transformation. And our team has been doing that. And I think more importantly than ever, we need to think about that whole person care. We've been talking about it. This is now 4 years I've been here in North Carolina. We've been talking about whole person care, physical health, mental health, and all of the social drivers of health. And I think COVID showed us how important it is to keep focusing on that whole person well-being as we move forward. So that is what our team is going to stay focused on. I'm so grateful for the partnership as we go forward in this hard work. And it's going to be hard, right? When you strain a system with crisis, it is going to be challenging, and we're not going to be able to meet all of the demands. We're going to work We're going to need to put resources and talent and creative thinking towards that as we go. Again, I think that one of the things that will help us get there is Medicaid expansion, where we can get folks covered with no investment of state dollars. And then we can use those state dollars for all of the other things we know we absolutely need to continue to improve access, recruit behavioral health providers, make sure that we have that infrastructure here for folks. So with that, I am sorry that I jumped in. I apologize. I thought I was at 9:30 and I thought I was joining early. I guess I didn't. So I apologize for that. So thank you so much. I see so many friends and colleagues who are on this that are working so hard. What a year. I have no words. I'm out of words. But thank you so much for all that you have been doing to make sure that communities across North Carolina have the kind of care that they need in this incredibly hard time. We're going to work together to make sure it's even better as we go forward. So thank you so much. Thank you, Jenny. Thank you, Senator Woodard. I see Senator Bergen up there, and I'm going to turn it back over to you. And also my last thanks to Cody Kinsley for all of his incredible leadership. So be kind to him because he's been working so hard. He needs a vacation. All right, back to all of you.
Thank you so much, Dr. Cohen. And we actually have words for you too. Thank you. Thank you for your leadership. Thank you for your energy, your enthusiasm. You're still as energetic a year into this as you were a year ago when we had you at breakfast. So it's amazing. Thank you so much for your leadership. I also forgot to mention that another recognition Dr. Cohen received just last week was from my city of Durham, a key to the city. And I hope you put that right at the top of your impressive CV. I have a key to another city. They don't open any doors or get you anywhere, but it's just a small way of once again, thanking you for your work. But as you all heard, whenever Dr. Cohen receives these recognitions, she's very quick to thank the incredible team of folks that she has around her. The men and women who work all throughout the Department of DHHS, here in Raleigh and throughout the state, making these great things happen. And one of those great leaders in our Department of DHHS, as Dr. Cohen mentioned, is Cody Kinsley, who is the Deputy Secretary. Many of us know him for 3 years up to now as the Deputy Secretary of Behavioral Health and Intellectual and Development Disabilities. But he took on this job. I don't know if you drew the short straw or not, Cody, but he's also the operations lead for COVID-19 response. And I don't know when you sleep. You look pretty good for a guy who's probably working, 70, 80 hours a week. Although the one thing more than that, Dr. Cohen says, so 100 hours a week. How about that, Dr. Cohen? So. But Cody, Senator Bergen and I decided we're going to chip in and get you a haircut. We think a year into the hair, you got to do it. I mean, look at me and Bergen. We keep our hair pretty well done. We were looking a little shaggy in the spring, but come on, dude, let's do that. So Bergen and I are chipping in. But Cody, thank you and the folks around you and your team for your incredible work as well. We know it's a team effort, and we appreciate that. So we're going to hear from Cody now to walk us through our keynote address today about the perfect storm. And then after that, Cody's going to be joined by Dr. Keith McCoy, who is the Chief Medical Officer for Behavioral Health at DHHS. With that, Cody, I'll turn it over to you.
Well, thank you so much, Senator Woodard and Senator Bergen. I'll take you up on that. As I was sharing with you before, I'll share with everyone. It's been 1 year and 20 days since my haircut. So, and it was about this time that we were together. So definitely keeping track of that. And that's perhaps the smallest aspect of all of our lives that has been impacted by what a tremendous and challenging year. But before I dive into that and talk about what we've been doing, I do want to first thank Jenny Gadd. We are incredibly lucky for her dogged leadership of this effort and this event pulling us together. And what I love about kicking the year off with this event is that we bring folks together from all over, from different aisles, different backgrounds, different cities and places, different states even, to talk about the one issue that brings us all to the table to have a meaningful conversation. And I think Secretary Cohen said it perfectly. What we know is that there isn't a one size or one solution that fits all in this space, and coming together to figure out what are going to be the ways to improve things together is going to be really critical for us. And I think that this pandemic has taught us more than ever that we are much stronger together than we are apart. And so I look forward to that collaborative sense as we are with each other today. I also want to thank Governor Cooper, who kicked us off, and Secretary Cohen. I have to say that we are very lucky to have their leadership where they think every day about mental health, about intellectual developmental disabilities, traumatic brain injury, substance use disorder, the entire kind of cohort of disability space. And not just thinking about how is this a special group that we serve, but how is it a group that is integrated and part of the community and part of our entire response. As much as we have a whole person response, we have to have a whole state response. And it's not by bringing a bunch of boxes together and making sure everybody's one-upped over the other. It's about how do we do this in an integrated and coordinated way. And I have the pleasure of being with them on a daily basis to talk about where we are with our COVID-19 response. And we often talk about our behavioral health response as being core to that. So again, thank you for their leadership as well. So about this time last year, and I'll say this before I turn on my presentation, I ended my talk, for those of you that were there, with the concept of belonging, in believing that we in North Carolina could strive to make a space where people, regardless of their different abilities, regardless of their medical needs, could be in a space where everyone could truly belong, could have access to healing, where we could have restorative sense of justice, where we could be together and with each other. And I'm really proud that during the pandemic this year, the department adopted a new value, and we've decided that value is also belonging. And in subscribing to believing that regardless of our diversity and our various experiences in life, that we need to not only bring people from different places together, but we need to make that table inclusive. And so this year's work has been so much about continuing to double down on that sense of belonging and continuing to realize that it is really incredibly hard work. And I think that the pandemic has showcased that for sure. So let me start my presentation. Bear with me. I am not as technically savvy as our technical support. So I'm hoping that we can see everything well. Okay, so the perfect storm. I couldn't think of a better way to talk about this event this past year other than that, and so let's dive in. So as many of you know, and Secretary Cohen just shared, that I grew up in Wilmington, North Carolina. I remember very vividly Hurricanes Fran, Bertha, Bonnie, these hurricanes that swept through North Carolina and truly upset our entire experience and our life. And I think this year we've really focused on 5 big buckets of problems that the perfect storm has created. First is, frankly, just maintaining day-to-day operations. Many of you will remember that in March, we started having weekly calls with consumers and weekly calls with providers. And I pledged to folks on those calls that I didn't know all the answers, but when I didn't know, I would say that and we would work together to find out. There was so much that we didn't know, and maintaining day-to-day operations, ensuring people had access to services, ensuring people could get the care when they needed care was such an incredible challenge that we all had to face and figure out together. We also know that we have many ambitious goals for the year. You heard me last year talk about what we wanted to accomplish, and continuing to drive forward on those goals in spite of having such challenges that the entire team was arising to was a real challenge for us. And Secretary Cohen mentioned Victor Armstrong. We are so lucky to have his leadership. This time last year when we were at the breakfast, he was there as a provider, a leader at a psychiatric hospital, and after a life of service in community mental health. And I was lucky to convince him to jump in with us and join us in the middle of the pandemic to become our director of the Division of Mental Health, Developmental Disabilities, and Substance Use Disorders. And I was so proud that he jumped into that, and his leadership has been critical for not only continuing our work and maintaining day-to-day operations, but in truly chasing and designing and operationalizing that future state of how our system could be and bringing all those solutions to the table. Of course, we've been talking about the COVID-19 pandemic, and you've heard, for those of you that have tuned into our town halls over this past year, you know that the pandemic has not only had direct effects and the anxiety that it creates, the uncertainty, the impact on ourselves if we get sick, on our loved ones and how we feel about that and how we respond to that, but it's also had indirect effects. You know, it's taken many of us and disrupted our daily lives. It's removed our social connection from others, and it's it's had disastrous impacts on employment and on other things that help us have stable lives. And the COVID-19 pandemic, as Secretary Cohen, absolutely will have a lasting tail and impact in our lives. And then, of course, this year has been a year in which we have had to wrestle with and realize, for many, what has not been a new piece of reality, which is deep-seated racial inequality in our state, and recognizing, and in our country, and that tension of people, Black and brown bodies losing their lives unnecessarily, and how we respond to that in a thoughtful way that is restorative, that is trauma-informed, that is understanding, and truly brings a sense of restorative healing together. And then social injustice locked in with that. These things, any one of these issues is a challenge. Maintaining day-to-day operations in our state, or designing the future and making change, or any one of these things is a huge lift in a given year. But to face all 5 of them at the same time, to try to manage that, is truly a Category 5 storm like no other. And so I want to thank all of you. I want to thank our providers. I want to thank our consumers. I want to thank our family members who not only came to the table to talk about what was working and what was not working, but had constant and consistent communication about how we could do better. You helped hold us accountable. I think we helped hold everybody and each other accountable. I also deeply want to thank Senator Bergen, Senator Woodard, Representative Cunningham, and other members of the legislature that are on today, who really took leadership roles in making funding for mental health available during this tumultuous time. You heard Secretary Cohen speak about the $100 million from our CARES Act funding that has been coming into serving North Carolinians. That doesn't happen without their leadership and their support. So I am truly grateful. I think the entire state is truly grateful for that investment in our system and investment in people's lives. What I do know about growing up in Wilmington is that on the other side of the storm, there is hope. And I think there were times when it has been very dark and very hard for us to see that hope and to know that there was a place for us to look forward to. But I believe now, and part of what fuels me to work the however many hours of work I am doing each week to keep driving forward, is that we have so many opportunities to make things better for people over the horizon. First and foremost is our COVID-19 vaccine rollout. And I know that Secretary Cohen talked about how our providers, our vaccinating providers, nearly 250 across the state right now, worked very hard to clear any backlog of first doses on the shelf and to use all first doses before we got our next shipment this past week. And they are on track for doing that again this week, that we want vaccines in arms as quickly as they're coming into North Carolina. And we want it done in consistency with the phase that we're in, and we want it done equitably across demographics, across race, and decrease access. And we know we have more work to do there, and the department is incredibly committed. One of only 3 states that has been publishing our race and access data for vaccinations, and we continue, as you know, transparency is another core value at the department, to continue to bring light onto this, to make sure that all North Carolinians have access. We also know that a big driver of hope for me is our strong and resilient provider community. Secretary Cohen spoke about how they rose to great strength, and went great lengths. Our team came together to find opportunities to create flexibilities and rules and requirements. And folks like Karen Dunn and others figured out ways to continue to serve people, even though their service model may have not been super adaptable to the current environment in which we're in. And that sort of creativity and thinking about how peers come to the table and thinking about how providers are reaching out to folks, and in partnership with the flexibility that the federal government gave us, allowed us, I believe, to continue to support people at a time that has been so challenging. Of course, Medicaid transformation continues to be on the horizon. And this is one of those things where I know that so many people want this and so many people want to move forward to this, but we also all want it to be done right. We also recognize that change is disruptive and we need to make sure that we move into it in a smart and thoughtful way. We have to get away from carving the mind from the body. We need to bring those things together, and transformation allows us to do that. We also know that our work on TCLI, which is truly about community inclusion, and launching our Olmstead efforts this year. Many of you serve on our Olmstead Advisory Committee. TCLI, our Transitions to Community Living initiative, was really focused on a certain population of individuals with serious mental illness who are at risk or who are in adult care homes, and in supporting them in being in community and having supportive employment, in doing diversion work and successful discharge from hospitals. And while we continue to advance on our efforts in that initiative, it was important to me and important to the secretary and our entire department that we bring a disability neutral approach to Olmstead inclusion. And we kicked off that work this year. Many of you are involved. It's hard work. And just as we have heard people with different opinions about ways to address the pandemic, there are a lot of different opinions about what folks need. And coming together through that work will take a lot of discussion, conversation, often disagreement, but then ideally resolution. And so looking forward to that work, also kicked off in the midst of this past year. Of course, what we are also lucky to have is that we've had new tools on the horizon and already in play that have helped us weather this traumatic storm. NC Care 360, which the department doubled down on. You know, I think you've heard me say before, having worked at a outpatient provider in Western North Carolina, I knew the best sometimes we could do for folks was to hand people pamphlets and ask them if they called those folks to get help, if they were hungry, they didn't have a safe place to sleep, trying to provide those services to them. I know many providers spend much more of their time supporting those whole person needs that people have than actually providing therapy in their area of expertise or providing other services. And so much of that whole person care, you know, whole person care is not a new idea for mental health providers. This has been core to your work for a very long time. And for our consumers know that in trying to face the trauma and anxiety that they may be facing, whatever that looks like for them, that if they don't have a safe place to sleep, or if they're having dental pain, or they're having other issues, it's very hard to address that. So very happy that NC Care 360 was invested in and was growing as this technology platform where providers could do resource referrals, our Healthy Opportunities work. But then beyond just scaling those in the past year, I'm really proud of our team's advancements of telehealth. I've said this before, I'll say it again. We advanced telehealth in North Carolina 10 years forward in 10 days time. We've seen uptake in a huge way. People have found access that never had access before. People like my mom, people like friends that I have that, you know, all of a sudden being virtual and talking to someone feels a little bit easier than it may have been to go into an office. And those sorts of preventative investments, making the call, having access before it gets more serious, helps prevent people from being in crisis and helps us use our crisis dollars as efficiently as possible. So I'm really proud of our telehealth expansion. I'm really proud of commercial insurers in the state who also stepped up to break down barriers for telehealth and for behavioral health services broadly. That sort of investment is a bit of a silver lining in this moment where we recognize how valuable that is, that everybody's jumped forward in that way. And of course, Secretary Cohen mentioned Hope for NC and Hope for Healers, two of our crisis lines that were really important to us to stand up. Hope for NC first, because I like to ask folks this when I talk to people one-on-one. If you or someone you knew was in crisis, who would you call? And most people say 911. Most people then say, I don't know. Those are the two common answers that I get. And it's hard, you know, when people are in crisis, figuring out who to call or what to do is not what you should be doing in that moment, right? We need everyone to know who to call and what to do. And in North Carolina, we now have one number that anyone can call, whether you are in crisis and you need serious immediate help, whether you just need someone to talk to, or whether you're looking for resources, you can call Hope for NC. And that phone number is, and it'll be on another slide, but I'll say it anyways, is 1-855-587-3463. And I hope that each of you, when we get to the slide, will put it in your phone and know this is one number I can call. It's co-located with the Suicide Prevention Lifeline. So some folks have the Suicide Prevention Lifeline phone number in your phone. That's great. You can use that too. It's a great number. But if you call Hope for NC, you're going to get same level of quality care and resources that you would call if you were calling the Suicide Prevention Lifeline. They can do warm handoffs to LME-MCO crisis lines. They can connect you with peers and others to talk to. So Hope for NC continues to grow as an important investment in our state for having one number. So I hope everyone will have that number, share that number, know that number. Hope for Healers, another investment in a phone line for our healthcare workers, our frontline folks, our teachers, our childcare workers who are experiencing a very unique moment in this pandemic with so much stress and trauma on themselves and their work life and their personal life. And we wanted to provide support to them. And that could not have been possible without a partnership with the North Carolina Psychological Association and many of you as providers who volunteered to be a part of that. I am so proud of the collaborative effort, truly, as I mentioned before, a coming together that I have never seen that has helped us weather this storm. And of course, as much as we are prioritizing our response, what is key to this is recognizing that true equity is not treating everyone exactly the same, but is in recognizing how the environment and this experience is impacting people and serving folks proportionate to that need. And we talk about historically marginalized populations in our communities, and we often think of Black or African American, Latinx or Hispanic, Native American, American Indian communities in North Carolina, all of which have seen the brunt of this disease in particular ways because of systemic issues with healthcare access, with employment, with communities, economic access, jobs. They have borne the brunt of this in a very specific way. But I want to be very clear that also core to our definition in historically marginalized populations are those individuals in our state with behavioral health conditions or issues, or those living with an intellectual developmental disability or with a traumatic brain injury. We know, and you've heard me say, and this was core to my talk last year, that individuals in those populations are so often pushed to the fringe of society, are so often pushed to the space where they end up in homelessness, or where they end up without a job, without health insurance, and therefore relying solely on the safety net, and likely ending up in a hospital if they're critically ill, that there is not a ladder for them to climb from when they are so sick. And our heart breaks for those folks who are so often found in these spaces, and they are historically marginalized. They're historically pushed to the fringe of our communities. And our response to COVID and our response to our work has been so focused on making sure that we are helping everyone and creating targeted responses and targeted solutions to those people. And I know that all of you have shared with us in that work in serving among us the least of these to do that very important effort. Of course, my mouse is frozen now, so we will see if this works. Hold on. So just to level set, as Secretary Cohen mentioned, pre-pandemic, we still had a lot of work to do. The LME-MCO spent nearly $360 million to serve 101 uninsured individuals in state fiscal year 20. 52,000 uninsured people each quarter. Secretary Cohen spoke about the 1 million people in North Carolina that don't have health insurance. Well, spending $360 million to serve 100 million people, it's a lot of money, but when you start to break it down, it's $3,000 some dollars per person. You think about 2 days in a hospital, a couple serious crisis events. When you think about the 2 million, when you think about the 1 in 20 people in North Carolina that have a serious mental illness, when you think about the growing number of people who have substance use disorder, it becomes to very clear that $360 million is really just a drop in the bucket to the need. And again, why I am so thankful for folks that have been for the legislature that has been so committed to serving this community in such a meaningful way. But as you can see here, the average spend just less than $1,500 a person. And the median spend of $396, what that means is that there's a handful of folks that are getting a lot of funding for key resources that are critical for them, right? This is not, fancy resources. These are key critical resources, but that the average person is just getting $396 or the median person's getting $396. Each year in North Carolina, 1.5 million people over the age of 18 have a mental illness. 1 in 5 of them, 20% of people, never receive services. So you take that $396 and you dilute it even further if we try to serve them all. Take that 1.5 million individuals with mental illness, 578,000 North Carolinians have some sort of substance use disorder, something that is at risk now for growing because of this traumatic event. But out of those 578,000, 8 out of 9 needed but don't receive treatment. And we know there are many paths to recovery, and we know that people have to take a self-determinate process. They need to make their choices. We believe in dignity of risk. We believe in people finding their path, but we also believe in extending a hand and providing that support and making it available. What we know with 8 out of 9 people not getting treatment is that there are many more folks who need and want treatment but cannot find a way to get it. And yet our system is so incredibly stretched, and was as we came into. And of course, perhaps the most tragic aspect is that suicide is a leading cause of injury and death in North Carolina. And it has been for many years. And we see that particularly pronounced in veterans and particularly pronounced in situations that include a firearm. And while suicide in and of itself is not a mental illness, it is not a substance use disorder, it is not a disease, it is the culmination of an experience that folks may get to when they feel they have no other path, no other option. And it often can include mental illness and substance use disorder as a part of that path. And by not helping folks and not providing preventative access, we continue to have a risk of suicide rates growing. And I just think a traumatic truth for where North Carolina is. So where's that hope again? As we have talked about Medicaid expansion, and I just want to be clear, closing the coverage gap, whatever it means, we have real issues. $369 for the median person getting some sort of service in our safety net. We know that that is not enough. We know there are a lot of people, 1 in 5 individuals with mental illness, 8 out of 9 with a substance use disorder, that don't have a path to any sort of care. And therefore, without a path to care, without a path to recovery, and without a path to recovery, without a path to getting employment and to being a full and participating citizen in our communities. But we know that it's not just about Medicaid. We know that, as Secretary Cohen said clearly, with an insurance card in hand does not necessarily mean that you have access to the behavioral health services that you need. And again, that's why I'm so proud of our commercial insurers in North Carolina that have stepped up to provide services and to lower barriers to behavioral health services in North Carolina during this time. And I think it's important that we continue to work together to provide those important, critical, life-saving, preventative services. If someone can have an ounce, it's been said, an ounce of prevention is a pound of cure. If someone can have some prevention that helps them stabilize, to address their trauma, to cope in a healthy way, and they can maintain their employment, they can maintain their insurance, they don't end up in a space where they may be, as their disease advances, uninsured, without a job, perhaps without safe housing, and where it's so much harder to help that person, and it takes so much more funding to help that person. Just a little bit of funding on the front end in a preventative way with our commercial partners and other insurers to make sure that folks don't slip into that space of being in the social and in the safety net. We know that North Carolina's children are facing perhaps a once in a generation and lasting negative experience. And I know that this is very important to Senator Bergen and to others, that our children are experiencing trauma like no other, and I could not agree more. And I also know that before the pandemic, that North Carolina ranked 42nd in the country for youth access to behavioral health services. And that is tragic, right? North Carolina, I believe, is, you know, the 10th largest state in the nation and the #1 state ever. And we need to be at the top of that list for our children and investing in them, because we can change the world by investing in our children and for tomorrow. And this is not an area where we should be skimping. We know that the opioid epidemic has continued to be a battlefront in the midst of this broader pandemic. And while we have had some success in keeping it at bay, we know that there has been an increase in opioid overdose ED visits at the same time. We know that 60% of our jail inmates have report symptoms of a mental health disorder in the prior 12 months. We know that 70% of individuals in incarcerated settings have substance use disorder. When you start to see so many people in those spaces, you have to begin to ask the question, why is there a connection? If 80% of people or 70% of people in jail had diabetes, I would wonder why. And I think it's a real and honest question for us to ask ourselves about our justice system in understanding how do we support people in these spaces and how do we provide pathways to recovery. This goes back to historically marginalized and pushed to the fringe of our community. And I'm very, very, very proud of the partnerships that we have forged with local sheriffs and local communities to provide treatment in jails, and to our, we put out a, upwards of $10 million funding announcement for local communities to apply to provide these services, to create pathways that give folks opportunities to get treatment and to recover and to pull out of the criminal justice system. Again, these are win-win opportunities where we save money on jails and the operation of them. We save money by serving people and doing intervention. Then, of course, the most important of intervention is really reforming our crisis system. One number, one place to call, easy access, and effective access. And we recognize there are real systemic problems in North Carolina. Not everybody has broadband. That's part of the telehealth story. Telehealth doesn't work for everything. Mobile crisis sometimes takes hours to get to people. It's not mobile necessarily, and it's not efficient in a crisis. And we can and we must do better. We know that while we have many psychiatric beds in North Carolina, that in a given year, only about 64% of them are used. And that's because there's an insurance issue or a coverage issue. So while people will struggle to find a bed, there's often beds going empty and not put to good use. These are all really important problems that existed before the pandemic and continue to exist today. And we must keep working on them. I'm proud of what our team has done to serve and to focus on these areas. I'm proud of your partnership and your feedback as we continue to work together. As I close, I just want to share with you once more our two things, really: Hope for NC, our number that I shared earlier, and then really a plea to all of you to take care of yourselves. These have been incredibly stressful times for all of us. We've experienced things that we never thought we probably would experience, and we've risen to challenges that perhaps we never thought or never should have to rise to. And so our team, in addition to being able to call, I want everyone to know you can call this number, and if you are in crisis, do not delay. It's very empowering to make the call. But also, I want to talk about Scoop, which is our effort to give you an easy way to remember how to take care of yourself. Stay connected to friends and family. I call Senator Bergen every day at 6:30 in the morning. And as a friend, it is really good to get his feedback, and he makes me laugh, and we try to stay together. And I think the other thing we do is have compassion for ourselves, right? We disagree on things. All of us, many of you talk to me, but I think as humans and as fellow North Carolinians, we can have compassion on each other, that while we may not agree on the next step, we agree on the destination, and that we are working really hard together to get our places in that space. We need to take care and watch our use of substances, whether that's alcohol or food or whatever that is to you. This is a time when trauma and stress is high, and it's easy to slip into misuse and abuse. Know that it's okay to ask for help, whether that's to me or to Hope for NC. There are people out there that are in a place that they want to help you, and it's very empowering to ask for that help. And then last, certainly not least, get physical to improve your mood. I've taken up to cooking and dancing, which is a little bit of a sight for my neighbors through the windows, but it's my little way at the end of the day of trying to put a happy cherry on top of what is sometimes a very hard and challenging moment. So remember Scoop, take a photo of that, share it around, and take care of yourself through the year. As we wrap, I just want to say back to this concept of belonging. You know, I, again, grew up in North Carolina. I grew up where we faced these hurricanes and traumatic events. And I remember from a young age that the most inspiring aspects of these moments was that everybody in the community came together. When a tree fell, the neighbor came over, folks helped cut it down, clear the yard. People were all out in the streets trying to make things better, trying to get things better back to normal. And people didn't stop at the property line. People didn't do just what was theirs. People reached across, whether that's reaching across the aisle or reaching across the fence line or reaching across the community or the neighborhood. People reached across to help a fellow person. And what is wonderful, I believe, about COVID-19 and this pandemic is that we have seen that. And what has been so hard about it is that we have not yet gotten to the end of it. And so while we are continuing to find a way to respond, we continue to be faced with new challenges every day. And that is incredibly draining. So I just ask for each of you to take care of yourself, to keep coming together, to know that it is not about, is my community getting what I need? Is my community getting what I need? Is my community? It's about how are we all coming together to help one another at this truly, truly challenging time. Thank you so much. I appreciate being here with you all. It is truly a highlight of the year. We're very lucky to have Dr. Keith McCoy here with us, who's going to, I think, kick us off with some questions. Thanks to everyone who submitted questions in advance. Dr. McCoy?
Thank you, Deputy Secretary Kinsley. Really appreciate your comments along with Secretary Cohen. Really important information to help us be focused, to take a moment about what we've, to realize and recognize and validate what we've been through over this past year, and to keep us focused and energized for the possibilities of what the future holds and the new tools that are available to us in part through the hard work of the providers and other stakeholders in this state, and in partnership with DHHS and the federal government to be able to move forward to build a system that's better than it was before COVID. Appreciate all of the wonderful chat as well from everybody. People are very engaged and connecting. I wish that we could connect in person, but this is a really important time for us to do this connecting so that we can work together and dream together about what comes next. Also appreciate folks providing some questions up front before the event, and I have some of those questions prepared for you, Deputy Secretary Kinsley. So one of the first ones, and the Secretary mentioned this, there's a long tail to trauma, to pandemics, to disasters. And I know that we are just beginning to see the uptick in utilization of crisis services in the behavioral health system and other resources, still during a time where we have some limited access due to extra precautions that are needed because of the COVID pandemic. So given that the trauma that the people of North Carolina have faced, that providers of healthcare have faced, people who've lost loved ones, curious how we are preparing as a state and as DHHS to handle the increase in clients in a system that has been fairly pushed to the max during this time. What sort of grief resources exist, and I know we've spoken about that in part with Hope for NC, and just dealing with the long-term effects of COVID for North Carolina and North Carolinians.
It's a great question. It's a reality. We see in our data that usually after a natural disaster or major event that the peak of need is really about 6 months later. But we know that folks are going to be cleaning up their lives and trying to find a sense of restoration for years after this event. And I believe it goes back to those investments that we were talking about earlier, which is very grateful for all insurers stepping up and lowering barriers to access to behavioral health. That has to be a critical. I'm very proud of our team. Keith, you and many others who worked tirelessly at the start of this pandemic to change upwards of 100 different coverage policies and requirements that made it more flexible for folks to find access and to get access. And then, as opposed to just sliding back into how we used to do things, have worked really hard to ask the question, well, what changes are good and what changes should we keep and why should we keep them? How do we balance ensuring folks are safe with also balancing that flexibility that we need? And I think that's another important area. I'm proud of the investment that we're making in serving individuals in incarcerated settings and ensuring that they have access to treatment and services. That has been an area that's been often overlooked. And I think it's an area where really a few dollars go a very, very long way in prevention and getting people on a path. And also, frankly, from a racial justice perspective, are incredibly important. We know that Black and Brown North Carolinians are often left out of our mental health system. They don't have providers that look like them, experience life like them. And so doubling down on how we can invest in growing communities of practitioners and providers in our networks that have those experiences, because there's many folks out there that do and they want to work, but they need to have the access. And that's why we've been investing in a lot of new partnerships, especially with our peers and others up and down the spectrum of behavioral health providers, to make sure that we're creating communities of providers that really represent and come from the lived experiences of the communities we serve. I think those sorts of transformational investments as we continue to look forward will be critical. And again, I think it's a reality as we come into the year together that investments in our long-term stability of our system is going to be required. And we have a very stretched safety net. And we've got to get it back to a place where there's a bit more bounce to it.
Yeah, I think all those things are really important. It's hard to overestimate the effect that the expansion in telehealth flexibilities has provided in the system. I think that that's been tremendous. It's something that North Carolina had wanted to do before the pandemic and had planned to do over several years and ended up doing over 2 months. And so many of these things are going to remain in place after the health emergency is over. And so that is an area of silver lining for us. I think one other program I want to give a shout out to, given that with the increase in behavioral health support needs that are needed throughout North Carolina, some of those responsibilities are going to fall on primary care to address, which is appropriate in some situations, but at times they need consultation. So through HRSA, we have the North Carolina Psychiatric Access Line that's run by Duke that now answers calls statewide for primary care clinics. It's currently grant funded, and I think it's important to look at a path for sustainability for that, but they particularly help primary care physicians with treating children with behavioral health disorders, doing so in a way that is evidence-based, rather than overly relying on psychotropic medications especially when those are inappropriate. They also provide significant consultation around youth and adults with intellectual disabilities. We also have the NC Matters program through UNC, which assists with primary care and OBGYN offices for women with peripartum mood disorders and other behavioral health issues. So those are really important resources that we'd like to see long-term. So another issue that I think is important has to do with, as you mentioned, the children's mental health services that we have in the state. You mentioned ranking 42nd out of 51, including DC states, and wanting to speak a little more specifically about how we move forward to remedy this gap that we see in our system.
Yeah, it's a really important point. And when I think of kids in North Carolina, the first thing that I think about is just how our system is structured. So right now, early identification of needs and resources for children is often through these area programs of sorts that are really linked to our public health system in the state and coordinated by our Division of Public Health at the Department of Health and Human Services. But then as kids turn 5 and 6 and they go into school, early needs and early mental health services and interventions are often on the shoulders of the Department of Public Instruction. And they're identifying resources to try to serve folks there. And then when they get later to the ages of 6, maybe 8, that's when they really get linked into our local management entity/managed care organizations to provide services. So in the first, perhaps 10 years of life, folks jump between 3 different things. And this doesn't, to me, feel like a recipe for success in a streamlined opportunity for folks that are, we need to be whole person, we need to be whole time as well in watching that. And I think that part of that is because we have a patchwork of funding, right? We've thought about how do we build a system in a bureaucratic way that aligns with where people are. Well, if they're in school, it's the school's responsibility. If they're not in school, well, who's going to do that? And I think that, we have to do better. And to be very frank and blunt about it, is that when you look at states in this rating of children, one of the key things that jump out is that states with Medicaid expansion do much better in these rankings. Because while, I've said this before, most children in North Carolina have some sort of insurance, whether it is a commercial insurance through their parents, or it is CHIP, or it is Medicaid. Most children in North Carolina have coverage. That number is actually, the uninsured number is growing, which is worrisome to me. Yet in spite of having insurance, most children in North Carolina would wait upwards to 4 months to see a child psychiatrist. And Keith, from your profession and experience that, part of that's a workforce issue and minting new child psychiatrists and that path. But I'd also believe that if we had the average person in North Carolina with insurance waiting 4 months to see a cardiologist, we'd be doing some other things differently to get more cardiologists in North Carolina. We have amazing medical training programs in North Carolina. And unfortunately, we have a lot of psychiatrists in North Carolina that don't bill insurance, that are cash pay only, that do not participate in these programs. And that requires a concerted response, a response from the state, investments in education from our medical training partners, and an investment from our commercial and public insurers to make sure that it is worthwhile and meaningful for psychiatrists to be a part of the table to close that gap. So I think that Medicaid expansion, to provide less gaps where people are not toggling between the uninsured is a critical part, but it really will take all providers to come together. I think that we also have to look at better and earlier identification. I think we still battle stigma. I think if there's a little bit of another silver lining in this pandemic, it's that more people are talking about mental health and behavioral health and substance use disorder and services for individuals with disabilities more than ever before. And it's become more commonplace and more part of our daily parlance, and it's more understood. Everybody finds some empathy in their heart right now for the experiences of others, and we need to hold on to that. We need to throw stigma out the window and keep realizing that 1 in 5 people in North Carolina will have a mental health issue in a given year. This is not the secret thing in the family. This is just every day, and that we need to work together to create a system that can respond with that level of consistency.
I think one thing I'd like to emphasize that you said is how important expansion of healthcare coverage is in that. Our provider system is able to sustain itself so much better when there is broad coverage rather than when there is more narrow coverage. And access really improves when that whole system doesn't have to figure out inefficiently, right, through all these wraparounds that we have, how to make sure that people are covered. There's a lot of additional overhead that's associated with having all these multiple systems. And, I think language is important when we when we describe what the value of having universal health coverage is. And for me, that language has to do with some pretty core American values. But to me, a system that allows its people to lack health insurance is the epitome of government inefficiency. It's the nadir of patriotism, and it's the opposite of supporting individual liberty. And I think these are really important concepts for what matters in America, in North Carolina. So we just have time for one more question. And this is a helpful one because I think there's a misunderstanding in the system when it comes to having adequate access and why folks are stuck in our emergency rooms. So is the issue that we need more beds, more inpatient beds, more institutionalized beds, those sorts of things, or is the issue something else?
It's a great point, and I know I hit this number briefly, and it's worth doubling down on for sure, which is when we look at all the licensed psychiatric beds in North Carolina, 80% of them are actually being operated. So there's 20% of licensed beds that providers are not operating right now. At the same time, of those 80%, about only 80% of that are actually occupied in a given year, meaning that we're only using about 64% of our potential bed capacity. You know, I think about any local business that is trying to make their bottom line work. If I told an Ace Hardware that there's going to be money for nails for 2 years, would they move into a community and build a new business? And we often talk a lot about needing more beds, and we've been building beds for the past several years. Folks know that the sale of the Dix property, where I'm coming from with you right now, the sale of that property was used to build beds that are part of our 3-way bed system across the state to create more community access. And that was an important investment. But what we now see loud and clear, that it's not just the money for the beds and building them, it's to operate those beds. And it's the fact that when we have so many people that are uninsured, that they're not able to get the access that they need to those beds in community. So that's a big piece one, is that how do we make sure folks can have the access? We can build as many beds as we want, but until we wrestle with the insurance issue, we're never going to fill that gap. It's going to keep getting worse. The second big thing that I think really is important to talk about is capacity restoration. Or forensic services that are happening in our state. So in North Carolina, when someone goes to trial before a judge, if they don't have the capacity for a fair trial, their constitutional protection, they're sent to one of our state psychiatric hospitals for services. That number of people continues to grow year over year. That's an important service that needs to be provided. But in many states, it's provided in communities or it's provided in jails. And it is not provided in state psychiatric hospitals where the most complex level of care is needed. Those folks, so we have to figure out how to provide more services and investing in community-based capacity restoration and other methods that are proven, evidence-based across our country in serving people. So that way our state psychiatric hospitals, which specialty is really serving the most complex level of care in the state, can provide that service. So I think it's more of a holistic view. And of course, perhaps the last thing here beyond all of this goes back to just an ounce of prevention being worth a pound of cure. If we can have a robust crisis system where people can quickly get routed to services, where there isn't a question of how it's being paid for, and when those services can think about not just mental health services, but social services to ensure safe housing and other things, then you know, our average cost in a state psych hospital is $1,300 a day. I can spend a lot of money taking care of people that would save money before they got to the state psych hospital. And look, I think we need all the funding we have in the state psych hospitals. I mean, people need, and we have a lot of people in EDs waiting. We have a lot of folks in other places not getting served at all. So this isn't about shifting money from one to the other. This is recognition that there would be a better way to spend money, and that a little bit of investment on the front end now could save us a whole lot of funding down the road, and could also make a much more meaningful difference in someone's life. And it's a lot better to invest in that prevention than investing in beds and investing in other things down the road.
Thank you so much, Deputy Secretary Kinsley. And thank you everybody for your attention and your questions, and we'll hand it back over.
Great. Thank you, Deputy Secretary Kinsley and Dr. McCoy for facilitating the Q&A there. And Cody, thank you. A great presentation as always. And we so appreciate all your great insight. By the way, we took a poll while you were speaking, and in a landslide, long hair wins. So don't cut it. And in fact, one of your fans thinks that you look like Thor. So keep working hard before you run off to Hollywood for your next adventure film. So anyway,
Thank you, sir.
thank you all very much, though. Fantastic information presentation again. Now I'm very pleased to introduce Donna Carrington, our 2021 Lived Experience speaker. Donna is the executive director of the Community Empowerment Fund. CEF is a local nonprofit organization dedicated to ending the racial wealth gap through direct interaction and relationship building that empowers its members to achieve their personal financial goals. A former member of the board at NAMI Orange County, she is a trained facilitator for a number of NAMI programs. Donna, good morning and welcome. We look forward to your comments.
Good morning. Thank you for that introduction, Senator Woodard. Start my speech with a quote from Elizabeth Kubler-Ross. The most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way out of the depths. These people have an appreciation, a sensitivity, and an understanding of life that fills them with compassion, gentleness, and deep loving concern. Thank you for allowing me to speak to you today about how I see this perfect storm. I am speaking to you as a mental health consumer, a single parent, and as an executive director of a local nonprofit, the Community Empowerment Fund. I want to say the problems and inequities that have showed up during this perfect storm are things we've all been talking about for years. Racial injustice, especially displayed through the ever-growing wealth gap, the need for more robust mental health services that support the needs of both consumers and providers, and the need for a better healthcare system paired with good policy around public health and disease prevention. All of these inequities and issues converged and made the perfect storm of 2020. A short history about me and where I have come from. I'm a mother to 4 wonderful, complicated people that are ages 25, 26, 20, and 17. I have struggled with my own mental illness since I was the age of 12, culminating with 4 bouts of postpartum depression, which made me seek treatment at age 33. As I was on my own path, each of my children were diagnosed with different mental illnesses of their own. Homelessness came twice, along with many of the health conditions we see among our homeless: high blood pressure, diabetes, heart attack. It took years for my family to become stable. That path was not a straight line. It took many loops and turns. However, in 2014, I started working for Community Empowerment Fund, and it changed my life. Little did I know that job would become the place where I would grow and change, and my family would grow and change. My life had already had elements of a perfect storm. Little did I understand how the storm would show up again. Let's talk about how the perfect storm of 2020 showed up in my life. After a tumultuous 2019, in which my organization was working through some issues, on March 16th, 2020, I became the executive director after working at CEF for 5 years. Who would have thought a person who struggled for years with mental illness and had been formerly homeless twice would have reached such depths? These were the platforms that my recent work were standing on. I was trying to create a trauma-informed community that emphasized empathy, kindness, and understanding. I was trying to help create a different image of homelessness, helping people understand that homelessness was not about what a person did or didn't do, but rather what had been done to them by the systems around them. Then COVID-19 changed everything. CEF had to shut down in-person operations right as people were starting to suffer. This caused real angst, especially for me, because I could picture people struggling in isolation. COVID-19 also activated my own fight with my paralyzing anxiety. How was I going to make decisions for my organization and for my own family? My then 16-year-old daughter started virtual learning, which in itself was another job. This very socially minded child suddenly was cut off from her friends and relying on me for everything. My 20-year-old son at the time suddenly became an essential worker because people still needed Domino's. The fear of keeping him safe when we as a nation did not really understand the monster in the room, when we were fighting about mask wearing and hand washing, was paralyzing. Luckily, I was always a person who bought things in bulk, so I did not experience some of the shortages that others did, but seeing empty store shelves was distressing. And then I got COVID. I still don't know how or where I got it, but as a person who lives with pre-existing health conditions, my family and I were afraid. It was scary to be sick. I read a lot about things to do. I moved around instead of laying down. I went outside and breathed fresh air, and I quarantined from my children. I worked remotely as much as I could, supporting my team, who were checking in with our members and making sure that we had the most updated resources. COVID changed everything we as an organization knew before and made us operate differently. Never before did I have to think about safety and cleaning protocols, temperature checks, wearing masks on a consistent basis, and other people's lifestyle habits. At times, it became overwhelming for me. My anxiety leads me to be constantly strategizing, trying to figure out what to do in every possible scenario, and this became exhausting. While COVID was happening, the racial unrest in our country was happening also. My organization had been struggling with what it meant to be a racially equitable organization for the whole of 2019, with the culmination of our work resulting in me becoming an ED. However, this wasn't enough. We still had more work to do. The world, and especially our nation, were having these conversations also. I, as a Black woman, was confronted with what it meant for me to be Black in a country that has never supported people of color, but to also be running an organization in that same world where leaders of color are scarce. How do I lead and fight for equity at the same time? The images of Black people being killed were wounding to my soul. I am raising Black men and Black women in a world where they can be hurt and killed simply for just being. When they are away from me, I worry constantly. The constant worry changed me. Finding allies in this work and in my life became the path I needed to survive. However, there is still so much uncertainty. As this pandemic and unrest was happening, everyone around me was struggling with mental health in ways I had never experienced before. NAMI Orange was able to hold a peer-to-peer class virtually, which was a source of joy and great pain. The joy was being able to support people who wanted to support themselves and others, and the pain was hearing how isolated and alone people were feeling, even to the level of despondency. The isolation and anxiety was causing people to be more symptomatic, less skillful, and although some were doing telehealth, it wasn't exactly helping many people because it was so complicated. Support groups and classes seemed to be more helpful to people because they got to talk and engage with others in similar situations. I too was suffering with my own mental health and not talking about it. Not wanting to be a burden to others, I kept showing up to support others. I also became a NAMI Connection support group facilitator and helped to lead peer groups while still struggling myself. What I realized about this perfect storm is that we should have seen this coming. Housing inequality has been pervasive for years, with more and more people experiencing housing insecurity and homelessness. Mental health services and policies have been a constant failure in many communities. It's been a nightmare to figure out how to get it paid for and difficult to offer good and affordable options to people to simply get by. There's such a stigma around mental health that many medical providers do not seem to understand that it is an essential part of being healthy. Our country was founded on racist policies, and they continue today. This storm will not easily be fixed. Hopefully, with this new administration, we can start to address some of the needs and establish some good policies. To the legislative panel that will follow me, there's a few items I would love to see in talks with how you're operating. Number one is advocating for a change to the PPP second draw legislation to make PPP loans more accessible to nonprofits and small-scale mental health providers. As the current regulations stand, nonprofit entities that are supporting local governments in distributing assistance through the CARES Act may be excluded from accessing much-needed PPP funding because the pass-through CARES Act dollars misconstrue their top-line income. Let's not punish our nonprofit community partners for the essential support that they are providing. Advocating for a shift in how our health insurance system works. In case it wasn't clear before the pandemic, it's certainly clear now. Having medical coverage tied to employment doesn't make sense. When people lose their jobs and are at a time of critical need, they should not lose their ability to receive mental health services or physical health services for that matter. As a system, we need to be advocating for single payer coverage so that everyone who lives in the United States has access to health care whenever they need it. Number 3, pushing philanthropy to support organizations led by people from affected communities. This doesn't just mean funding organizations led by Black people, though that's obviously a good start. It means reducing barriers to entry for funding and funding organizations led by people with lived experience with the issues the organization is working to solve. This could include mental health, homelessness, poverty, or disabilities. To name just a few of the areas where we should be looking to people with experience for their leadership and expertise. Philanthropy, which includes private foundations, individuals, and families, need to work to simplify funding processes to be more transparent in their decision-making and have faster turnaround times so that organizations do not need to wait for that funding. We also believe private foundations need to start spending down their endowments. Understand that we cannot effectively change the current systems without a lot more dollars to support this work. We know this is possible, as many processes did change at the beginning of the pandemic, making funding more accessible and available quickly, at least temporarily. The perfect storm has shown me that it is time to get to work and advocate for the changes that we need. No one is going to do it for us. I hope I can count on all of you to join me in this work. I would like to end with a second quote. She is a beautiful piece of broken pottery put back together by her own hands, and a critical world judges her cracks while missing the beauty of how she made herself whole again. Thank you.
Donna, thank you. This proves why I think our shared experience presentation every year at one of these is always the best part of the program. So thank you. Very heartfelt, moving, and some incredible stuff there. Thank you. And a lot of thoughtful things for especially those of us in the policymaker side to take away with us. So thank you for sharing. That was just incredible.
Thank you.
Thank you. The Paul Luebke Legislative Champion Award of Mental Health is presented to honor the memory of my former neighbor, my great friend, and eventually my colleague, Paul Luebke. I keep one of Paul's signs in my office just as a reminder of all the great things Paul Luebke advocated for during his career in the State House, and mental health was first among those. Paul was a tireless advocate for improving and expanding mental health services in North Carolina. And this recognition honors members of the North Carolina General Assembly who exemplifies Paul's dedication. It was first presented in 1917 to Orange County Representative Verla Insco, who we all know is an incredible champion of mental health. Then to former Senators Tamara Berenger and Tommy Tucker in 2018. And then in 2020, former Representative and now Labor Commissioner Josh Dobson was honored. My former Durham colleague, Floyd McKissick, was honored in 2019. And while Floyd has left us now to serve at the North Carolina Utilities Commission, he still cares a lot about this issue. And Commissioner McKissick is with us today, and he will introduce our 2021 honoree of the Paul Luebke Legislative Champion Award, Representative Carla Cunningham from Mecklenburg County. And with that, Commissioner McKissick, I'll turn it over to you for the presentation.
Thank you, Senator Woodard. And let me thank all of you that were so instrumental in organizing this event today, Jenny Glad in particular, but I know it's difficult and challenging trying to pull this together virtually rather than having 300 or 400 people together there at the Friday Center. And let me also thank Senator Mandy Cohen and Cody Kinsley for the amazing work that they're doing in these unprecedented times, as well as their team at the North Carolina Department of Health and Human Services. Well, in 2019, I was honored to receive the Representative Paul Luebke Legislative Champion Award on Mental Health. Today it is my honor and pleasure to present the 2021 award to Representative Carla Cunningham of Mecklenburg County. As Senator Woodard has noted, this award honors the memory and achievements of the late Paul Lupke, a friend and colleague of mine, served Durham in the General Assembly. He worked tirelessly in the legislature and the community to educate us all on the critical need for comprehensive mental health services. Representative Cunningham carries on that focus and commitment in her dedication to address the inequalities that continue, and perhaps even more evident today as North Carolina and the nation face the perfect storm of the pandemic, racial inequality, and social injustice. And of course, Representative Cunningham has also been a champion of trying to rid our society of gender inequality. I know she was the House primary sponsor of the Equal Rights Amendment. I worked on that in the Senate. I was the primary sponsor, but I think we all understand that if women were equal in the eyes of the law and weren't making 78 cents on a dollar, that would help even more today than ever in the past, particularly with their more single mother households with us. But today, we honor Representative Cunningham for her past achievements, but more importantly, for her ongoing and forward thinking in the North Carolina legislature as current mental health needs escalate because of increased social isolation and economic stress. And we commend her for her advocacy to ensure that our most vulnerable community members receive safe and appropriate assessment and treatment, as well as supportive services to enable independent living and employment. Now, in this virtual meeting, which is so unprecedented, and I know you've all been sitting for a while, I ask you to stand and clap and honor Representative Cunningham as I hand her the 2021 Representative Paul Lupke Legislative Champion Award on Mental Health. You have earned it and you deserve it, my friend. Thank you so very much. Magical.
First and foremost, thank you, Commissioner McKissick. I have enjoyed working alongside you for numerous years on the Equal Rights Amendment, and I can't thank you enough for your steadfast support of the work that I've done in the House. First and foremost, I would like to thank the Legislative Breakfast for your continuous effort to lifting mental health, intellectual developmental disabilities, and substance use disorders in North Carolina communities. Today, I dedicate the award, the Representative Paul Lupke Champion Mental Health Award, to my son, daughter, my family, and the many families in North Carolina that have walked the journey of life with courage, facing the challenges of dealing with access to mental health services. Last year, I shared my family's journey with you at the breakfast, and I recognize my family's journey is not that unique to any of you all. Like many of you participating in the event, my family has been on this journey for over 24 years when my son was first diagnosed with mental illness and a developmental disability. It's been a journey of challenge and continues to be a journey of hope. This morning, if I did not mention Medicaid expansion in some form, you all would ask, what's happened to Representative Carla Cunningham? Well, like many families across North Carolina, I know what it's like to be a parent, a nurse trying to further her education to lift her family out of poverty, working 2 to 3 jobs through nursing agencies to stay afloat. I know what it's like to roll pennies and put gas in your car. I know what it's like to almost be financially bankrupt due to numerous hospitalizations of a family member in a behavioral health hospital. I am not going to speak long. I'm going to close with this. I see you. I also hear you. The 600,000 people in the state of North Carolina, their families that lack some form of healthcare coverage, because I've been that family member in the same capacity, in the same position, struggling to get those services for my own son. And yes, I'm still inspired. I'm still hopeful, and I'm still passionate about what we can do in the state of North Carolina to move forward with some type of healthcare coverage form for those individuals that lack access and lack the care that they need, especially for their mental health, developmental disabilities, and substance use disorder issues. I want to just thank you for being here this morning, and thank you for giving me the opportunity to share. And Senator Woodard, thank you as well, and every participant on this call across our state and other states that are listening this morning. Our work is not done. There is more to do. Thank you so much.
Congratulations, Representative Cunningham. Obviously, you're touched, and I think we would all agree, those of us who work so closely with you here at the General Assembly and all across the state, your passion and compassion make you an incredible leader. So thank you. And I'm so glad I get to work side by side with you on so many issues. I'm glad you just moved down the hall this year too. So we're going to be joined at the hip fighting for so many of these great things. Thank you for your leadership, and congratulations once again. Very, very well deserving. Commissioner McKissick, always good to see you, friend. Miss seeing you around here, but we know you're busy doing other great things. Our final section, as it is historically at our breakfast, is our legislative panel. And this one's going to be really good today because we have 5 incredible legislative leaders, all great thought leaders in healthcare, all good friends and colleagues of mine. So that'll make it even more fun. Bicameral, bipartisan group of legislators who are going to spend some time talking with us about mental health issues. I'm not going to introduce them because they'll be introduced by our moderator today, and I get the great pleasure of introducing her to you. And to do that, I'm going to put on my North Carolina Health News mask. If you look very carefully, you can see the North Carolina Health News logo right there. And this identifies me as a reader and supporter of North Carolina Health News. And if y'all aren't regular readers of that, you need to be. It is my must read every day. It's bookmarked right at the top of my web browser, and I look at it every day. And I so appreciate the great work there of the team at North Carolina Health News. Our moderator today is the editor and founder of that great publication, Rose Hoban. We all know Rose from her great work at North Carolina Health News. Those of us here on Jones Street see her around the building when we're here, and we read her great work every day. She is a nurse by training, moved into journalism, and has become a real important part of our health coverage here in North Carolina. With that, I'm going to step aside and introduce Rose Hoban, who'll be moderating our panel. Hello, Rose.
Hi, everyone, and thank you for that lovely shout out, Senator Woodard. I'm glad that got to you in time. And hopefully there's plenty of people across the state who are going to be wearing those masks in coming weeks, and hopefully we won't have to wear them for that much longer. Anyway, I want to thank you all for inviting me to moderate this panel again this year. It's always a tremendous opportunity to hear from our legislators here in the state. And I have just a couple of housekeeping things. I've been seeing a lot of chatter on the chat. As a matter of fact, some folks have asked about how they can share resources, and you can share them in the chat. And then at the bottom of the page, at the bottom of the chat box, you can do, there's a little box with 3 little dots in it. And if you click on that, it will say save chat, and you can save the chat with all those resources in there. So keep that in mind. That's a way for you to have a way to save all of the great suggestions and comments that are being made. For the purpose of this session, I'm going to ask folks to, if you have a question during the panel, I'm going to ask you to drop them into the Q&A, which you can see at the bottom of your Zoom screen. You'll see a little thing that looks like little talking bubbles, and it says Q&A. You can put your Q's and A's there, and I'm just being told that attendees don't have the option to save the chat, but I know that the organizers will save the chat and they'll be able to share all those resources with you. But if you can leave your questions in the Q&A. We also have questions that came in with the registrations, and we've organized them. We have a lot of questions. We're going to try and get through them, and you're going to see me having legislators kind of be terse. I'm going to ask for them to be terse. So without any further ado, here's my watch. I'm going to be timing them, and I'm going to introduce our legislative panel in alphabetical order. So first up is Senator Jim Bergen. He represents District 12, which is Harnett, Johnston, and Lee counties. And welcome, Senator Bergen.
Thank you. Nice to be here.
And next up is our honoree. Hopefully she's managed to put herself back together. Representative Carla Cunningham, who represents District 106, which is Mecklenburg County. And congratulations, Representative Cunningham.
Thank you. Glad to be here this morning. Thank you so much.
And the next person up is who will be joining us is Representative Pat Hurley. She represents District 70 in Randolph County.
Yes, thank you for having me.
And
I've been here times.
I know you've been here quite a number of times, and I'm always amazed that you drive all the way to Chapel Hill. It's a good hour-long drive, so I'm sure that today is a lot easier.
It's better. Thank you.
And then also someone who's more local to the legislative breakfast is Representative Marcia Morey. She represents District 30 in Durham County.
Morning. Great to be here. Thanks.
And then finally, we have Representative Robert Reeves, and he represents District 54, which is Chatham and Durham counties. So welcome, Representative Reeves.
Thank you. Glad to be here.
So when we practiced earlier this week, the representatives and the senators, they'll be raising their hand when they want to weigh in, but I'm going to ask questions and we'll have a whole discussion. And, part of me is tempted to just, here it is, it's coming in on the Q&A. So I think I'm just going to start off with asking about, we've heard about access to care. We've heard about the ability for people to receive care if they can get to care. And the question of Medicaid expansion has come up year after year. We've been asking it for 6 years now. It's a critical access issue for many people to have Medicaid. The pandemic has resulted in probably 200 to 200, maybe 300,000 people in the state losing their employer-sponsored health insurance. So the question is, what is the plan for Medicaid expansion this year? Do you think we could see it? Is there a way to find some compromise between the two camps on this? And I'll let folks weigh in. Who'd like to start on this one? I know it's always a tough one. Let's get it out of the way. It's a really important question. So maybe I'll call on someone. So Representative Reeves, I know that you're in the leadership in the House on the Democratic side. What are your thoughts about Medicaid expansion this year?
Well, thank you, Rose. I would just say that I probably would join with everybody else on the panel. And yeah, the bottom line is that decision is going to be made by the majority at this point. I don't think there's any confusion about positions on Medicaid expansion. What I would say is I want to see the most people in North Carolina get insured in the most effective and efficient way possible. And whatever it takes to get there, I'm all ready to go. And I think I can speak for a lot of people, at least in that House Democratic caucus, and say the same thing. Just tell us what we've got to do. Let's get these folks insured. Let's get people's premiums down. Let's get hospitals saved, and let's get to work.
Senator Bergen, I know that I see that Representative Hurley has her hand up. And I also know that you folks participated in the governor's task force around healthcare access. Representative Hurley, what are your thoughts on this year?
Well, when we first became the majority, we were $2 billion in debt because of Medicaid. And we do not want the state to get into debt again, because we are the #1 economic state, I think, within the top 5, because we have used our money wisely. And there will be a payday. They keep saying there's no state money involved. Well, there will be. The federal government, which is taxpayer dollars, and they do have the authority to print money. We do not, and we do not want to bankrupt North Carolina, because right now we have at least 2 million people on Medicaid, and they want to add more. We do not want to put right now we are really good at spending the money, and children get on Medicaid regardless. And a lot of people, there's an awful lot of fraud in Medicaid. If we could stop that, we'd probably have enough money to pay for everybody. But somebody's looking for ways to get by without paying. But the fraud is very, very high. And I don't think that we will expand Medicaid this year. I think we don't know how much money we're going to have yet. So we are going to see, and 58% of our budget goes to education. And so there's 20% left, and 20% normally goes for health and human services, which is we need more. But I don't think that we will expand Medicaid this year. There may be some legislation to address certain parts of it, but I don't think we will go totally to expanding Medicaid.
That is one of the questions that's come in through the Q&A window, which is, you say that there are some things to get some care to more people. Are you able to expand on some of those?
Well, to have some of the nurses and the practitioners and the psychiatrists to be able to do extra and telehealth and telemedicine, I'm hoping that those things will be done. We shall see. I don't know. We're just getting started. Starting to, all the bills that were there last year are gone. This is a new year, and whatever was there, if they want to run them again, they can run them again, or we can all run them again. But we have just begun, and it remains to be seen what will come up and how much money we will have to spend. I'm on education appropriations and not health appropriations, but I do have a heart. I have a heart for this, because I know that was the #1 thing when I came in 2007, and the children, I didn't realize that the children were still not being taken care of and not being cared for. And I guess they're still going out of state. We do have 2 new places in North Carolina now for children. Guilford and Harnett County, I think, have a place. But there's a lot of work to be done, and I certainly want to help.
Representative Cunningham, you have your hand up.
Thank you. I was hoping I was going to yield to Senator Bergen to hear his thoughts.
Be happy to.
Since we both serve on the governor's committee.
Yeah, I'd be happy to talk about it. And I'm serving as one of the healthcare chairs this year, and it's a priority for me and our caucus to get healthcare to folks. And I think you're going to see a lot of good things. This pandemic has really changed things and made things, I think, become easier to do. Who would have thought that we would have jumped into telehealth, and that we would have started doing a lot of the things. Scope of practice, the governor relaxed a lot of the issues on access to care. We want those things to continue. When you talk about the SAVE Act, and you talk about all of these other things that we're going to be looking at. I mean, I'm working on bills right now that are going to target areas. I think that we need to extend the amount of time that new mothers can stay on Medicaid. I think that needs to go to at least 6 months or a year. We want to target the families and the individuals that are the most at risk and help them. But Medicaid doesn't need to be a healthcare system that's a way of life. I wish we had a system, and we would put a time limit on it, that you could stay on it. Then we could actually address more people and help more people. In last year's budget, we had 1,000 new innovation waivers. those didn't get pushed out. I want to do that. I want to get those folks off of that. We've got over 12,000 people on a waiting list right now, and I want to deal with that. And I think there's a way to get those folks some care. Maybe we don't do a full waiver. Maybe we do a partial waiver. So I want to look at that. But we've got to back up and start with children at conception. We have to change our lifestyle. We have to change. I mean, we are so prosperous in this state that it's kind of become a big problem for us. Obesity is a big problem in this state. Hypertension is a big problem in this state. Heart disease is a big problem in this state. And all of those run-up costs that make it hard to deal with a lot of the other things. So I've been talking to a lot of you about a program that I want to do called One Generation, that we start with conception, follow folks through, and in one generation change healthcare and health in North Carolina. So I'm excited. I want to thank everybody for letting us even be here today. And thank you for not canceling this event. I thoroughly enjoyed the last time being with my friend, Representative Cunningham. It's always good to be with Mike Woodard. He's just a good friend. Jenny, thank you. Max, Cody and I talk all the time. And you know, a lot of us are working together to get things done. And even though a lot of people think that there's a lot of battle and bickering and stuff, most of us are really good friends, and we want to do good things. Let me back up. We want to do great things for North Carolina and healthcare, and I'm committed to do it. And mental health is my passion. We are going to do big things on mental health, and I promise that I'm going to work on it.
Okay. Representative Cunningham, but before we do, I'm going to limit folks to 90 seconds, and I'm going to start saying, I'm going to start interrupting you. So, and I've got a little timer here that I'm just hitting folks. So Representative Cunningham.
Okay, thank you, Rose. I hate I got the time limit, but I really did want to hear the views from Senator Bergen and Representative Hurley. Right now, what we do know about the Medicaid expansion is that over 200 and something thousand people lost their jobs. And when they lost their jobs, they lost their insurance coverage. That includes their children. The second thing we know about the Medicaid expansion is that it will cost more for us to do a carve out. It would be like 65% return instead of a 95% return. So a plain Medicaid expansion is better for North Carolina and for the cost of it. The other thing on the innovation waiver slots, that's a tough one. We do have that 13,000 individuals in the state of North Carolina that have been waiting in sometimes 7 to 10 years to get the care for their adult children who are IDD or mental health or dual diagnosed, as you say. So we have to move forward. We also had 2 hospitals in the state of North Carolina that ran behavioral health facilities and no longer do that as of last year. So we had a mental health crisis prior to COVID, and the expectation is that we will see a significant uptick in the need for those services once COVID settles and return to some type of normalcy. So Medicaid expansion is very important. It's a matter of how we do it. And I think we're working on that. I think we need to keep talking about it and find a medium so that we can get it done and cover that 600,000 people in the state of North Carolina, because I've been one of those people. And if you've had that up close experience, you understand.
You did a great job, Representative Cunningham. That was 92 seconds. Thank you so much. You managed to squeeze a lot into that short amount of time. There's a lot of chatter on the Q&A panel here, and one of the things is that I've seen this in my own research, that Medicaid expansion tended to save states money because you have fewer people using emergency services, showing up at the emergency room. In particular, it tends to save money in the mental health space. So how is that perhaps a place where folks could find some agreement on moving forward? Representative Reeves, you have your hand up.
Yes, and I really wanted, if Representative Moore wanted to go, I want to give her an opportunity to go because she hasn't had a chance to speak, but I did have some points I wanted to bring up that I think would be helpful in the discussion. Did you want to go, Representative Moore? Okay, all right, well, what I wanted to do is I think sometimes, one of the things I want to clarify for a lot of people out here, because you've got an amazing event, an amazing number of people listening, and I know sometimes that you're dependent on us for information. And so one of the things I wanted to point out, and Representative Maury and I have a particular viewpoint on certain parts of legislation because both of us work along the criminal justice system. And I think that Representative Maury and I can agree, especially, there's no such thing as a system that people use money that's not going to have fraud, none. So if we operate on the position that we can't operate a system because of the potential for fraud, you literally shut down the government's ability to give money. I've seen companies that are multi-billion-dollar companies that still defraud the government whenever they get government contracts. I've seen the best people in the world with the most resources in the world still defraud people when they get a chance to have that. What I want to clarify is, especially what you said, Rose, mental health is the biggest place where Medicaid does us a service. Because almost by definition, folks that have severe mental health issues don't have access to the care that they need. And it becomes a revolving door. They're going to get some service, whether it be through the jail system, the justice system, the emergency rooms, or wherever. It will save us money, in my opinion, to give them that service on the front end to try to help them control and help situations that they have, instead of continuing to be people that present on the back end. So I would just say that I want to make sure that was clear to people that most folk that I know that need Medicaid don't want to be in that position in life. Most of them. I can't imagine somebody who's sitting around waking up one day and saying, I've got a couple of things I can do today. I could be in a better political or economic situation, or I could stay on Medicaid. Most would like to be in a situation where they can get health insurance, but we just don't have it available for everybody, because for all of us that are having great successes in life, there are people on the other side that just can't make it for reasons that have nothing to do with who they are. So thank you.
Representative Reeves, okay. So one of the, I think one of the places that we can agree that everyone, or Representative Maury, do you want to weigh in, or should we move on to kind of the next question? Okay, so go ahead.
No, let's move on. I know we have a lot of questions. Everything's been well said.
Well, you know, one of the places that we all can agree, and one of the largest groups in Medicaid right now is our children, and their children's mental health services are in North Carolina are ranked near, you know, at or near the bottom for all 50 states. You know, what's your understanding as to why this is, and what can the legislature do to help remedy this lack of services for children and adolescents? And anyone want to give that a try? Representative Hurley, thanks for being so game. I really appreciate it.
Well, I do know that we don't have enough psychiatrists and doctors and nurses, enough people to take care of all the children and everyone who's having this. So we do need to look at trying to recruit more into North Carolina, and we do need to try to see what we can do. And I worry about the children in the beginning, the responsibilities that they're being taught, and it does begin in the home. We need to try to be sure that the children are getting the care and the nutrition and everything that they need. And we do early childhood care. And this is a big part of it. We don't know the environment that they're in. And we do know about the suicides that are horrible. I know Representative Cunningham has worked on this so much. And children just cannot take defeat. We need to let them take responsibility. We need to teach them responsibility in the beginning. And I'll be working any way I can with Carla and others to try to help, and Senator Bergen, to try to help to do what we can to help. I just don't want to bankrupt North Carolina. The money is not there. The federal government is dead in trillions. Our grandchildren and great-grandchildren are going to be responsible for this forever. And we just need to be careful with what we do with our people. I mean, taxpayer dollars. We just need to not bankrupt everybody. Thank you.
Representative Maury, I see that you have your hand up.
Yeah, thanks. And I come at this from having been a judge for 18 years in Durham, and especially specializing in juvenile court. and to see the problems, the mental health issues, the behavioral issues that bring kids into the delinquency system. You know, the number one thing we can do is get them behavioral help, psychiatric help, and that's where we need to invest a lot of money to put kids in detention because of a developmental disability, for substance abuse, for behavioral issues. We cannot put them on waiting lists. We cannot keep them locked up because they deserve our attention and we need to fund it. We need to put more money into DPS to get these kids help, because if we do it right early on, we're going to stop the crescendo of the school to prison pipeline and paying for them through the criminal justice system. So I think this has to be one of our top priorities, to get North Carolina out of the bottom of 42nd up to the top in how we're helping our kids, even if it's specialty courts for substance abuse, for mental health issues, to really do all we can to support these families and support our children.
Thank you so much, Representative Maury. What about you? I see you've got your hand up, Representative Cunningham.
Thank you, Rose. There are three things: access to care, which would work for prevention, early intervention for the trauma, and also mental health parity. We still have an issue with mental health parity and costs. Even though you may have an insurance card, that doesn't necessarily mean that you're going to receive equitable costs when you go to a mental health professional. The access to mental health professionals is in great demand. It was already in a great demand. And we know in the eastern part of the state, which I'm not from, but I'm very abreast, that in the eastern part of the state, there's a limitation on the access to qualified for psychiatrists, psychologists, and other healthcare professionals, such as nurse practitioners. And that's another issue. If we would allow nurses to practice at their highest scope of practice, that would give more access to those places in the rural areas in the state of North Carolina. But we also know that lots of parents are experiencing hardship and struggle during this time. And a whole lot of them was experiencing it prior to this time of COVID. That's going to be a continuation. So we have to look at that we are doing preventative services and early intervention, not just for children, but for adults as well. Because my son is an adult that continues to receive services frequently under the LME and the MCO to keep him stable and a functional, prosperous, productive member of society. So we've got to do more in that aspect. Thank you.
Representative Cunningham, you were like hitting that 90-second mark. I really appreciate it. I don't know if you all can hear my little phone pinging through my speaker here. You know, that does bring up an issue, Representative Cunningham. There's some questions here about the SAVE Act, about what can the legislature do to help promote the creation of new practitioners? Is it the SAVE Act? Is it something else? Does anyone have any thoughts around that? And just as a reminder for folks, the SAVE Act was a bill that would allow for advanced practice RNs, such as clinical nurse specialists, nurse practitioners, et cetera, to not have to have physician supervision so that they can practice more independently, open practices in rural parts of the state, et cetera. So Representative Cunningham, I see you have your hand up.
Thank you so much, Rose. Let me go back to the ACA. When the ACA was brought about, which is the Affordable Care Act, inside of it was, part of it was to allow all of the advanced nurses practices to practice at their highest scope of practice. Why did they do that? The reason they did that is because we don't produce enough physicians. It takes 8 to 10 years to get a physician out. In order to increase access, you would allow them to practice at the highest scope of level of their profession. Well, also it's a money thing tied to it. I'm gonna be straight about that. It's a money thing tied to being up under a physician. Some counties, rural areas have a nurse anesthetist that work inside of that hospital because they can't get a permanent anesthesiologist to work in that area, but they still have to function under the direction of a physician, but they may not even see that physician. They may talk to him twice a year or send their check or whatever twice a year, and that's that. They're still practicing, but we need to do that because it would increase the access in those rural areas where they lack enough primary care physicians and other physicians to provide those services. That would definitely improve the healthcare outcomes in the state of North Carolina.
I know that the SAVE Act was introduced in the last legislative session. Do we know if it's going to be introduced again? And where do folks stand on that? I mean, we've heard from Representative Hurley and Representative Cunningham, or where are people on this particular issue?
You want me to check?
Well, Senator Bergen has raised his hand.
I'll talk about it just a minute. I think we're going to be looking at all scope of practice, and we will be doing something either through the COVID bill or through individual legislation to deal with it. I think there's still 3 counties in North Carolina that don't have a doctor in them right now. And I don't know how many counties don't have a psychiatrist. I know from talking to Cody, we needed to hire a number of psychiatrists about a year and a half ago, and it takes forever to try to get psychiatrists. I've been to all of our mental health hospitals and a lot of the other facilities that deal with mental health and treatment centers and opioid centers and folks, we need people in those, doctors, nurses, psychiatrists, counselors. We need all of those folks. And we're going to have a real situation coming up with nurses. A lot of nurses are going to be leaving the nursing profession because of COVID. I've talked to a number of them. They're either going to go ahead and retire or do something. And my time's up, but I'll talk about community colleges and what I've asked them to do later.
Oh, community colleges, that's a great resource that we have as a state, and we have a terrific community college system. Along the lines of funding the mental health system and funding Medicaid, there's been a number of questions here about single stream funding. We saw significant cuts to single stream funding to the LME MCOs. That's the state funding that, I need to stop. The single stream funding is the way that the state funds services for folks who don't have any other form of reimbursement in the LME MCO system. We've seen some big cuts over to that in the system, and I think this year that perfect storm showed how that single stream funding really undermined LME MCO's ability to get help to people. What's the prospect for single stream funding this year? Does anyone have any thoughts on that? I mean, I know Senator Bergen, did you say you're in appropriations?
Yes, ma'am.
So, has there been any conversation amongst your colleagues about what will happen to the single stream funding this year?
Yes, ma'am. In fact, we've got a meeting next week where we're taking each one of these topics and going through and looking at money. We're waiting for money reports right now. That's the big thing. Until we know the total amount of budget we're going to be able to, the budget starts in the Senate this year, so we will be working on it and then sending it over to our friends in the House for them to work on it. So as soon as we get those numbers, we're going to have a great idea. But I want to deal with a lot of these things. I want to deal with single stream funding, more money for mental health, more money for innovation waivers, more money for these targeted programs we want to do to deal with the folks. I still want us to move forward on the association health plans. We've been waiting on that. We feel like 150 to 200,000 people could pick up insurance through association health plans. So we're really working on a lot of different ideas that I think people are going to be impressed with. I think people are going to say these are good things and they're helpful things, but at the same time, we maintain our financial integrity. One of the reasons North Carolina is going to come back after the pandemic faster than anybody else is because of the way we went into it. Financially strong with money. We were able to spend billions of dollars that other states couldn't spend because we had a rainy day fund, a very good rainy day fund. And folks, I think after the first quarter of this year, you're going to see a huge change in what's going on. I think with the warm weather, the people that are being vaccinated, the herd immunity, all of, I think the perfect storm that took us into this could also bring us out of it.
Mhm. Thank you for that. Anyone else have anything to Representative Cunningham?
Thank you, Rose. I would speak on the single stream funding. We did have to put some additional money a couple of cycles ago back into the single stream funding. A lot of people don't know what the single stream funding does, but it covers those people that are uncompensated care that the LMEs and the MCOs have to oversee. But on the single stream funding, even when the COVID came about, we had to put additional monies out of the COVID funding that came down from the federal. Initially, we had to put more money out of that to MCOs and LMEs because we got so many people that do not have any type of healthcare coverage, and they're filling our hospitals in the emergency rooms while there's a pandemic going on. So we're going to have to relook at single stream funding as ongoing, but not just during COVID. But I can see the expectation that it's going to be a significant need if we don't figure out a way to ensure those additional people that are still filling our emergency rooms that lack any type of healthcare coverage. Thank you.
Well, you folks are now getting the opportunity to meet my mental health professional here. This is, she's my amateur mental health professional, but she's been very helpful during the pandemic. So she may be appearing. She just came back from her walk.
Great service dog.
Exactly. You know, speaking of training, there's a question that we received during the registration period to see what about training for law enforcement professionals. You know, this is a real issue, I think, for folks around IVC, handling folks with mental health disabilities. I see Representative Hurley. Are there any thoughts around in the legislature around addressing this issue?
I think that the crisis intervention teams is one of the greatest things that had been started. And that started in 1987 when a mother had called about her son having problems, and they came and he was killed. He was shot because they didn't understand that it was a mental situation. And I think that not only the law enforcement people, but the hospital personnel, all of us need to know when you can determine against a criminal, whether it's a criminal act or whether it's somebody with a crisis, and the crisis intervention teams, as well as the crisis centers, have taken a big load off of our hospitals. And I definitely think we need to do more that way. And I know local communities are really involved, and our community colleges are really involved in this. And I think that is understanding what's going on for all of us, communication and understanding the behavior, you know, I think helps all of us to know what is going on and be able to help those who are in need. And I'm certainly for helping, you know, in any way I can.
I saw that Representative Maury put her hand up on this question.
Yeah, thanks, Rose. One thing I'd remind people that Governor Cooper formed a task force on racial justice, racial equity in the criminal justice system. And, you know, we had 7 months of meetings, 40 meetings, public hearings. And one of the big focuses was how do law enforcement address 911 calls? You know, and I agree with Representative Hurley, the crisis intervention teams. Charlotte is doing a great thing with mobile crisis units, but it takes the entire system to look. How do we deal with the racial equities when we incarcerate 6 times as many people of color as we do whites, when we stop 4 times as many people of color for marijuana use than we do whites, and there's equal use across the board? We have to look at these racial equities along with awareness and education on mental health disparities. Our system used to have drug courts, substance abuse courts, all that was cut by the state. We have to come back and look, how do we not criminalize these issues, but get the treatment for it? But I'm proud of this report. I think it's a great report. It's about systemic racism that we have to address and what we have to do on our mental health issues. And we cannot incarcerate people out of this.
Thank you so much, Representative Maury. And Representative Cunningham, I saw you had your hand up.
Thank you, Rose. One of the things I wanted to let everybody know that 17% of the people that are incarcerated in our correctional facilities, 17% have a mental health diagnosis. So we're starting to house them in institutions, prisons, instead of providing them the care that they need outside of the prison walls. You know, when you start thinking about crisis intervention training, it takes about 40 hours a week for the law enforcement officer to get trained. Mental health first aid doesn't take that long. So we, under the Criminal Justice Reform and Law Enforcement Community Engagement Committee that was created by the Speaker of the House, we worked on that committee to look at some of the things that we need to look at as far as law enforcement and the community. It was the chokehold was one of the ones that came out as a recommendation. If I'll see that move, I don't know. But crisis intervention training for all of our officers in law enforcement is a need. It's just that finding the money to invest in them to take that 40 hours and get that crisis intervention training. Most people, when they have a crisis with the mental health, they don't know who to pick up the phone and call. They just call the CMPD or they just call 911 and say, I got an issue going on. But actually what they can do is call and say, I request a crisis intervention team to show up instead of having a regular officer to show up, because they're specially trained on how to interact. The last thing that I'll say, we're expecting police officers to do 5 and 6 jobs. We're expecting them to be our social workers. We're expecting them to do medical things that they're not trained to do. So what we did in Mecklenburg County, we now have mental health professionals that go out with our police officers. There's a program that started in Ohio called the Cahoots program. They've been running that program for years that decreased the interaction and the fatalities for over 45%. And that's what we need to be looking forward to, is how do we manage inside of these communities those behaviors and putting the proper people there to interact with them, assess them, and move them over to the services that they need.
I let you go on a little longer about that, Representative Cunningham, because that sounds super interesting. I just texted one of my reporters and I said, story for you. So thanks for letting us know about that. You know, does anyone else have thoughts about this, or I can move into a related question? And I love the idea that, you know, it seems to me like there's an opportunity for the mental health community to educate their constituents about when someone calls the police to ask for the crisis intervention team. That's a terrific suggestion, Representative Cunningham. Thank you so much. You know, moving on to something related, you know, we've seen increased attention to healthcare in jails this year and the state prisons, in part because of what COVID has done in those places. But, you know, in past years, jail deaths and suicides have been an issue. And there are some rules from DHHS to prevent them. But, you know, how well are they enforced? And is there something that the legislature, what can legislators do to help the jail and prison systems to enact these policies more consistently across the state? Senator Bergen, you have your hand up.
Yes, I've been serving for last term and then again on this term on the Select Committee on Prisons. And so we've been visiting prisons. I've been in local jails. I've been to, you know, it's Central Prison. I've walked out on death row, you know, visiting with folks. And I think a lot of the problem is we are not taking the services into the prisons as much as we need to. I've talked to Cody about this, and we're trying to work out a way where we get into the prisons, get into the jails. My sheriff, Wayne Coates in Harnett County, estimates that about 50% of the folks that he has incarcerated have some kind of mental health need. I'm not going to say they have a full-blown diagnosis, but they have a mental health need. So we need to be treating those folks there. I'm also a big proponent of long-term injectables for mental health, and we're going to be working on something to allow pharmacists and others to do the long-term injectables. I hear all the time that people get out of a facility and then they quit taking their medicine because they don't like the way it makes them feel, or while they're on their medicine, they're fine, so they don't think they need their medicine. I talked to someone just this week that his mother-in-law has been in and out of mental health facilities because she will not take her medicine. So that's something that I'm really looking into and want to help do it. But I want to get services into the jails so we're not just running a turnstile of people getting in, getting out, getting in, getting out. We need people to be able to stay home, hold a job, function in their community, and have a successful and profitable life.
Thank you so much, Senator Bergen.
I'm getting better.
You were sort of right on. You were right on there. So is anyone else, Representative Cunningham? I see you have some thoughts to share.
Yeah, thank you. On the jails and the prisons, I'll stay on the jails. One of the things that we know in the last couple of years, there's been a significant increase inside of the jails under the sheriff, not necessarily under the police department, but under the sheriffs that have overdosed and committed suicide. And those numbers have been significantly increasing. And I'm curious and looking at putting forth some legislation that we do a study and start to collect the data. We need to know why these people are dying inside of the jails. And we must remember, these people have not, in most cases, been convicted. They're in a holding space. We had a 17-year-old to die a couple of months in the jail in Mecklenburg County. He was on suicide watch. Now, how he died, I don't know yet. And I think the family has already reached out to look at what is going to be available to them. And you want to know if they under suicide watch, is the protocol being followed inside of the jail so that you won't have these incidents occurring. And we've had a person overdose in the jail. And I get calls from all over places talking about their loved one is going to jail instead of going to a substance use treatment facility because there's a backup in getting a bed of 45 to 60 days. So we've got a lot of issues in that aspect. And I think we need to take a good hard look at what's going and how we can address it before it gets to that point. Thank you.
Again, you know, this brings up for me something that I've thought about for many years and wrote about more than a decade ago, is the profound lack of housing opportunities for people with mental health disabilities. Cody talked about the TCLI program, which has been used to fulfill our obligations under the Olmstead decision from the Supreme Court. But you know, I think the time frame for that is coming to a close. Do folks have any thoughts about helping to create some resources or legislation that could encourage the creation of housing for people with mental health disabilities? Does anyone have any thoughts about that? Senator Bergen.
If no one else was, in fact, I was at a meeting in Lee County, not before last, with the commissioners and with the city council folks, and they are working on doing a center for the homeless. But they know that the majority of the folks that are homeless have some kind of mental health issue. Right. So I want to look at ways where the state can partner with the local municipalities and counties to come up with options and let them kind of guide the way they want it to go, but let's make sure that we can fund it. You know, if you get somebody in a secure environment where they're off the street, where you can assess them and start treatment and get them on proper medication, I think we can do this much faster. One other thing Cody was talking about, I always say it's $1,300 to $1,400 a day to keep someone in one of our 3 mental health hospitals. On any given day, there's 100 people ready to be discharged, but no place for them to go. Right. And at the same time, there's about 100 people in emergency rooms waiting to go into those mental health hospitals, but we can't get them in there. If you run the math on those, that's over $200 million that we have that we could spend on folks it's a housing issue more than it is a treatment issue. So I want to try to deal with the logistics of that.
Mm-hmm. Yeah, that it's very true. I think that one of the things that often gets lost is that the costs get calculated, but sometimes the potential savings don't get calculated as robustly And so I think that's a really important insight, Senator Bergen. Does anyone else have thoughts about this before I move on? Go ahead, Representative Hurley.
I think I have, when I was on Health and Human Services, a lot of the people who have mental health problems do not want to go out on their own into their own housing. They, I think, enjoy a group setting rather than that. So we need, I think, more places that, and I know elder parents are passing away and their children, have no place to go, and they haven't planned for it lots of times. And there's just a big need here that we do need to look at. And I know there's been studies, there's been situations, but I know Representative Cunningham has maybe some insight on this. Thank you.
Well, in other words, what's most important is for folks to have choices about where they can go, whether it's to a group home setting or maybe with just a roommate, or if they want to be independent. Representative Cunningham, it looks like you have some thoughts.
Yes, I would say that lots of these individuals want to be productive members of society, and they want to be treated just like a person that does not have a mental health issue or a substance use issue. So we do have some independent housing with wraparound services so that these individuals can be successful with, once they become adults, they can move on their own, they can get the assistance to keep their bills paid, keep food in the house, and there are vouchers that help them set their homes up. So there are some options there, and they do assess them and see if they qualify to a level of independence that they can function with minimal assist from the LME and the MCO. But they want to be just like treated normal, just like us. And as they become adults, they want to be a man and they want to be a woman and have the same opportunity to enjoy what we have the opportunity to enjoy. So we need to look at doing more of it. And even for the homeless and the veterans, a large majority of them have some mental health or have some PTS going on. So there's more that we can do in that community, but it's going to take a lot to move forward because we've already been in a housing shortage in the state of North Carolina for years. We can't build fast enough and the land is running out.
I think that's if folks are looking for a model, one of our neighboring states, Tennessee, has done a terrific job in creating housing for folks with mental health disabilities. And, that's a great place to look. It's a state that looks a lot like us, has a similar cultural background as North Carolina. And there's a lot of resources that they developed in that state. If no one else is interested in responding, then I'm going to move on to something that's similarly related, but that is coming up, and it's coming up also in our reporting. And that's the issue of what's happening in the state with involuntary commitments and also the transporting of folks during involuntary commitment. What we've found in our reporting is that the vast majority of the time, folks who are being transported from an emergency department where they're waiting for a psychiatric bed, when they're going to that psychiatric bed, they end up in handcuffs, something that's a deeply traumatizing experience for these folks. Is there some way to perhaps change the policy? Is there some way for the legislature to get involved in helping this change so that this traumatizing event is not going to be visited on folks who are already vulnerable? Representative Morey, looks like you've unmuted yourself.
Rose, it is a huge issue. It's not only when they're being transported, it's when they're being brought into court. I would preside over a lot of these IVC hearings, and not just handcuffed, they're shackled. And for the family members to see their loved ones sitting in court on a mental health issue and then a commitment to further traumatize them with the shackling, I think we need to keep in mind safety, but there's often ways to do this without the extraordinary means of shackling. and that we should look into that, and all the least restrictive means are necessary, and to do as little transporting as needed. We're doing a lot of things virtually now. We need to do some of these IVCs more virtual. But also the revolving door, that people do get a commitment and then they're out within 3 or 10 days because of space issues. So there's a lot to be done. I hope we look into that.
Mhm.
Rose,
Anyway, Representative Reeves, he hasn't had a chance to say much, so I'm gonna give him a chance.
Well, thank you, Rose. And I'll try to be brief. I just really wanted to piggyback on what Representative Maury was saying. One is an issue about making sure that we have the facilities to take care of them once they're in. And that'll help out a lot, but especially on the shackling issue, I've witnessed the same things that she has. And I actually noted Sheriff Blackwood brought up the point that I was going to bring up, is that this is another area where we can use specialized teams, people who were actually trained in the transport, trained in the handling of folks in these situations, because obviously they're pretty extreme situations. And if we had people who were ready to take care of these situations, you'd have less need of the shackling, because it is traumatizing. I think that, if you've never either been in handcuffs or had a family member in handcuffs or any of that sort, that's traumatizing for a person that is completely without any type of mental health issues. And so, then you put somebody who's already in a vulnerable state in handcuffs, not because they've done something especially wrong, but because they just are having problems that we need to help them address. It just makes things worse. And then, just like Representative Maury said, then you turn right around and put them right back out of the facility that they need to get their help and care from, and they never get a chance to recover. So I completely agree that increasing housing, getting more specialized teams help solve that problem, and it helps make everybody else safe.
Terrific. Thank you very much. And Senator Bergen, you were looking to weigh in.
I was just going to say, a couple of years ago, I got a call from someone about a child at an emergency room that was handcuffed to the bed and had been there 3 days, handcuffed to a gurney. And we don't need to do that. We don't need to do things like that. Part of it is we need to make sure that we're not taking those folks to an emergency room. We need to get them to a facility. I was also at a facility in Durham, and their policy is the police actually can take folks straight to that facility and drop them off. And we were talking about the restraint. They said that the second they see them, they remove, the handcuffs, and they're never restrained like that again. They deal with it other ways. We just need to train our folks. I don't want somebody getting injured trying to deal with someone. That's not a good solution. But there is training. There are ways. There are medications. There's things that we can do. But taking somebody that's having a mental episode and restraining them is never good in that situation.
And I see that Representative Cunningham has got some thoughts on this.
Thank you, Rose. I think one of the things that we have to think about as parents or loved ones or family members is seeing the person in already a mental health crisis and adding that additional that you've got to see them in handcuffs when it's just a behavior or maybe a mental issue crisis going on. I think that, we've got to invest more in the proper training. I know for me, I have seen my son that way. I know for me, I've seen him be under suicide watch within a facility. But you know what they do? If they can take them straight to the hospital, that's the best option. Mm-hmm. But in some cases, they may not be able to take them to the hospital because it's not available space. During COVID, we've had people laying on the floors inside of triage facilities. We've had them lined up outside waiting to get in because they need emergency services for their mental health issue that's going on. We're in a crisis, but we've got to invest in it going forward because we were already in crisis before then. Can you imagine if your son or your daughter is going through a crisis and the police pick them up and take them downtown and they're suicidal and they take all of their clothes? They have no clothes when they put them inside of that jail cell, and that's for safety. But you don't want that when you have an option to get emergency treatment inside of a behavioral health facility, which right now is backed up, and we don't have enough transitional beds for these people to wait to get the services that they need. We're in a sad predicament right now.
Mm-hmm. The thought occurs to me as we're talking about this, that the state does not have, the state has limited funding for mental health courts. And it ends up being left a lot of time to district courts to find that funding for the mental health courts. What can, is there perhaps a legislative remedy for this, whether it's financial or more of a mandate? Like, does anyone have any thoughts about that? All right, we don't have any thoughts. All right, Representative Hurley, go ahead.
Well, I do know that we had drug court and we had different things, but it costs more because you get the administrative people too, and it does cost more when they have the specialized courts. But ours decided on family court rather than drug court. And I think you have to make decisions and you have to see how many courts you're going to have and use your money wisely. And I think when you're budgeting, I think the county can help. And I think that, of course, the state, there again, it's education is 58% of our budget. We have only some like 4 dimes left for the other agencies. So we're going to have to figure out a way to help in the needs that are number one here, because they can't help themselves. Those that have mental health issues, they cannot help themselves. They've got to have help from others. So we do need to look about this.
Representative Moore, you had your hand up.
Well, in the courts or therapeutic courts, you don't want people in the courts if they don't need to be there. I mean, the judges are encouragers. You don't want the response to someone who's violated by locking them up. But unless you have the foundation of the treatment, the courts can't do much. And so when we have defunded treatment for substance abuse or mental health, just having a mental health court without that assistance isn't a lot of help.
Mm-hmm. Mm-hmm. And Representative Reeves, you put your hand up there for a moment.
I did, and as always, Representative Moore said it better than what I was getting ready to say, but that is absolutely correct. I mean, it's got to be a holistic approach, but I can tell you again, as somebody who practices in the court system, I am a big believer in the specialized courts. I think one of the courts that pops into my mind right now is my main practice counties are actually in Senator Bergen's districts. And so, he and I would always have a chance to interact back when I used to represent Lee County, but I still work there, so I care a lot about that. So with that being said, one of the courts we had was Veterans Court. It was the baby, and then Senator Bergen was very instrumental in helping us get that. Our past elected DA really cared about this court, and it's a perfect example of why these courts work when you have all the surrounding systems there. The good things that you have with Veterans Court is all these veterans had, veterans hospitals they could go to, and they had treatment that they could get through government. And so watching what that would do, we've got one judge in particular that I wish she could go around the state and talk about it, because she's done that court and she just talks about, I remember I had a client who had a simple driving while license revoked. But he's a veteran, they put him right in that court, and your immediate thought is, what's the big deal? It's a traffic ticket, you ought to be able to do it. But they uncovered so many other issues he was having, and they were able to help him, and they kept him from being back in our court system. So I'm a strong believer in those courts. I hope legislatures and counties get together to make those happen.
Mm-hmm. That's a really great point. Senator Bergen, you put your finger
I was just going to, and look, Robert's a dear friend. I love him, and I appreciate you bringing that up, Robert. He, Harney County started the first Veterans Court in North Carolina, and it's been just tremendously successful. We have very, very few people that end up back in the legal system because of the folks that are running it, and they're military, they understand, they know where to go get benefits. I wish we could do that for every person that goes into the court system, provide those kind of services. And that ought to be our goal, is to treat everybody like that so that we get them to the proper services.
Mm-hmm. Thank you for all those. That was a great conversation. One of the questions that came up, and I think this is really an interesting question. What would be helpful for you folks as legislators to know as in your role as legislators. And like what can be done? I mean, other than, there's 6 of you here, there's 170 of you total. What can be done to help educate legislators about these issues? Representative Cunningham.
Thank you, Rose. I think exactly what you all are doing this morning is bringing people together, putting the issues out in front of the community, because that's where they start. And if we can hear their voices mean more than anything. They can pick up the phone, they can call us. And I get a lot of calls, believe it or not, from across the state on issues with the Department of Health and Human Services, developmental disabilities, substance use. I get those calls, and I probably get them because I'm a nurse, but by no means do I have an expertise. By no means do I know everything, but there are people that we can touch and reach out, such as NAMI, Mental Health America, as well as numerous other organizations. Even our hospitals have a plethora of knowledge. We have a behavioral health hospital in Mecklenburg County. I can pick up that phone and get stats and talk to them and say, what's going on at this hospital at behavioral health? And that's what we have the capability of doing. But we're here to hear from you, hear your voices, and that's the value. It's not us that value, reverse it, because your voices matter the most to us.
What's the most effective way to reach you? Is it a phone call? Is it showing up at your office? What is it?
Yes, you can make a phone call to my office. You can send an email, but emails sometimes can come in volumes and I may not get to them as fast, but people call me at home too. My number is available. You call me at home, I'm gonna pick it up and you tell me what the issue is and I'm gonna get on the phone after that. And you can call the office and, we have one office person. It's not like Congress. We have one legislative assistant. So that one person works closely with us to see that we handle things or that we get back to the people that we need to take care of things. Thank you.
Thank you. Representative Hurley, you had your hand up, and then Representative Reeves and Representative Maury.
Yes, I feel like as legislators, maybe we could have a mental health caucus. Just an idea.
That would be fascinating. I think I've seen a couple of folks turning on their and giving big thumbs ups. I think that meant the social workers are doing that. So Representative Reeves.
I would say the most effective legislation that ever gets passed in that chamber comes from you. It comes from the people, it comes from our constituents. The most effective thing that you can do to help us do these things is just what Representative Cunningham was saying, except I'm not going to go as far as call me at home. Appreciate you, but I'm available 16 hours a day. So, but what I would say in all seriousness is individualized stories have an amazing effect. You'd be shocked how many times just the right story that talking to the right legislator gets something moving and gets a movement moving. I know when my first bills passed, it came from an individual story. But with that being said, the biggest thing you can do is walk into the office of your legislator with no biases. Don't look and say because they're this party or they're that party or because they've got this background that they already have an opinion on your subject matter. You walk in there and pretend that you are talking to a blank slate, because the best legislators we have are blank slates. They do not bring their individual biases, concerns, or problems or issues and background in there. They want to hear from you. And if you give them that information and give them information, believing that they're going to listen and they're going to talk to you and they're going to interact, you can really come up with some great solutions. Mm-hmm. And thirdly, I would say it's always great to come up with solutions that don't cost a whole lot of money. But, and I say that jokingly, but in all seriousness, you'd be surprised how many times that that we're an impediment as a legislature to actually counties and cities doing things. Sometimes counties and cities have monies and have resources and they're ready to go, but we've done something to stop it. And so, help us out, but just come to us because we're not experts. Representative Cunningham, she actually is a brilliant person in this field and this area with health and human services. But, a lot of us are just like me. I don't know, and I need you to tell me. So thank you.
Mm-hmm. And in the chat, someone said here, Representative Hurley for the win. Woo-hoo. There's a lot of support for that idea, Representative Hurley. Representative Maury, any thoughts about this? I saw you had your hand up earlier.
Thanks. And Representative Hurley, I'll sign up. I think
Well, I'll need a co-chair.
I think this is the most pressing problem we have, especially in light of COVID. And I think what Representative Reeves said, a story. And I had a story from a parent of 2 little girls who are virtual schooling. And her 13-year-old said, I can't do my math. And the mother said, why? And said, it makes me anxious. Well, what happens? Well, I get depressed. Well, what then? Well, I think of suicide. And what all of us are going through with mental health stresses right now with COVID. And, you know, it's overwhelming. It's not going to just end with the vaccines ending.
Mm-hmm.
They estimate 1 in 5 people who have experienced COVID will suffer from mental illness disorder. UNC is opening up a post-COVID treatment center in Chapel Hill. But I think, you know, all of you that work in mental health, we as legislators have to prioritize this for everyone who's been in social isolation, for how our kids re-enter, you know, schools. The work's cut out for us, and I just honor everybody's service. Thank you.
I think Senator Bergen, sorry. You have a thought.
I've been asked this question about 3 times this week about how to approach legislators. And I tell folks, you got to develop a personal relationship. Everybody that's on this call either knows somebody or personally knows one of us elected officials. And we need, you know, you need to develop that. You need to talk to us, not just when something's wrong, but all the other times. And please don't bring us books of material to read. We get, every day I end up with a stack of 4 or 5 inches, and we get about 500 emails a day. So, you know, I tell folks, you know, come in. I'm a Baptist. I say I like 3-point sermons, and I like 3 requests. Bring me 3 requests at a time. I'll work on those 3 things, and then you can bring me some more. But keep it, you know, succinct, keep it very focused, but develop those personal relationships. And the time to do it's not when there's a catastrophe. The time to do it is an ongoing time.
Mm-hmm. As Senator Bergen, you know, it's not just the Baptists. I was educated and ruined by Jesuits who said the same thing. A good sermon is a strong beginning, a strong end, and no more than 3 points in between, and it all needs to be short. So, well, you know, speaking of keeping things short, we are about 2 minutes shy of the absolute drop dead time. So I've been asked by the organizers to take the opportunity to thank everyone, to thank these legislators. Let's give them all a round of applause. A thank you for spending some time with us this morning and you know, allowing themselves to be put on the spot and to answer these questions honestly and thoroughly. I really appreciate everyone's time and honesty. And the organizers have asked me to thank everyone for attending, and we'll be seeing you during the legislative session. We'll be seeing you in the coming years at the Legislative Mental Health Breakfast, but I would love to see us back next year. No COVID, people addressing their PTSD, people gathering together in one place, able to support one another as we start this, you know, long recovery from this crazy year. So thank you so much to everybody for joining us today. And with that, I think we'll be signing off. So thank you very much.
Oh, Rose, I think I've got a couple things to do.
Senator Woodard, sorry, you're the closing act. Okay.
Yes, thank you. Yeah, don't take away all my jobs from me. But Rose, thank you very much for always an excellent job facilitating 4, 5, 6 politicians. We're a tough crowd to manage, and you do it well. And I want to be sure to thank Senator Bergen, Representative Cunningham, Representative Hurley, Representative Maury, and Representative Reeves for a great conversation today. And thank all of you. While the pandemic forced us to meet virtually, our commitment to raising awareness around the issues of COVID-19, racial inequality, and social justice on mental health really just moved us forward today and moves us ahead in 2021. Our event today has been made possible because of the hard work of a lot of volunteers, service providers who were here, my fellow elected officials, and our sponsors. And thanks to all of our speakers. This is always such a great panel. We learned so much, a great event, learned so much great information. And thanks to all of you who registered and attended, almost 700 people who signed up and joined us at some point during the day. So just take the messages and the things you learned back into your community and let's put them to work in this new year. At this point in our previous face-to-face events, I usually say travel home safely and see you next year. This year, I'm going to say stay safe and don't forget your 3 W's and wear your mask, whether it's from North Carolina Health News or not. But always remember your 3 W's. And remember to mark February 26th, 2022 on your calendar. February 26th, 2022. Let's hope that we're back at the Friday Center enjoying breakfast and each other's company when we convene for the 44th legislative mental health breakfast. And thanks again for attending. Take care of yourself and take care of each other. Bye.